is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed.
Thank you, members, and I declare the meeting open to the public online. I'd like to welcome all of our members who are participating by video conferencing today, and I'd like to remind members about the protocols regarding the use of electronic devices. So, Carol Nicotine has advised that she will be late today and has given me authority to vote on her behalf under Standing Order 115, should that be necessary. Are members aware of any other apologies? No. Thank you, members. Okay, members, moving on then to Chairperson's business. A couple of items I wanted to just mention to members. Firstly, I did a meeting this week with the RNAB, Institute for the Blind. I do have concerns coming out of the meeting in terms of the accessibility to information for many people who have sensory difficulties or particular sensory challenges. I know we have raised this with the department before on behalf of those sectors, but I think given the fast-moving situation we're in now, and given the complexity of some of the information around LFT tests and things like that, I myself find that I have to follow them step by step to ensure I'm doing them correctly. And I think there's maybe a need for us to check with the department what they're doing to support people with sensory disabilities in terms of accessing public health information at the present time. So would members be content to be right and ask for an update from the department in relation to that issue? Yeah, thank you, members.
Chair?
Yes, go ahead, Paula.
Just to go further, I think part of my concern has been that the lack of the press conferences from the Deputy First Minister and the Health Minister, and the availability then of the ladies who provided the sign language interpretation. I suppose as we come into Christmas and things are changing quite rapidly, as you say, I think that we should be calling on the Executive Office to be reinstating those, even just as a one-off, so that people are up to date with all the current regulations and requirements.
Well, actually, yeah, and it actually might be an idea to write to all departments and ask them to consider that in terms of any information they're sharing, that they consider their strategy and approach to communicating with those with sensory difficulties. So I think that's a useful. Could we copy more widely in on that? Yeah. Okay, Paula, thank you. The other thing, members, I was going to propose, if members are content, that we move back to fully virtual meetings on Thursdays to avoid people travelling. Where it's possible, I think we should try to do those virtually again for a period of time, given the messaging that's coming out from the department and given the request for people to reduce contacts where they can and to support, public health messaging in that respect. Would members be content with that? Yeah, thank you. I want to also welcome, and I'm sure everyone does welcome, the additional funding for social care that has been announced yesterday, and it's a very welcome additional step, although I have to say that I did a meeting recently with a large number of carers, both domiciliary carers and care home staff, and pay, conditions, terms that they're working under are absolutely unbearable, and I have to say it's well overdue. It's very welcome, but there is a bit of a lack of clarity, I feel, in terms of exactly what staff are being covered by the payment, how much they're likely to have their pay uplifted by, and also how many packages this is likely to support out in the community. So I wonder if members be content to be right to the department to ask for some further clarity around those issues. Yeah, thank you. Yeah, and finally, members, today is Carers' Rights Day, and I know a number of members here in the committee attended the all-party group on carers AGM yesterday. Carers' rights are today. I remain very, very conscious and concerned about the lack of full return to daycare and respite and the impact that's having on carers out there. And I know we have written, and we have currently written to the department asking for an update in relation to that issue. But further to that, I'm also, I suppose, very disappointed that there has been no, there is no currently scheme under consideration for a COVID recognition payment for carers, and the Minister has indicated that he is not going to proceed with that after having indicated that he was looking at it. Would members be content to be right to the department asking them, in light of the fact that they are not proceeding with that scheme, what else is being done at this present time to recognise and support carers in terms of the very arduous roles they're having and difficulties they're experiencing now, particularly as we go back into a period where there will be restrictions. I see Pam indicating there. I'll just check with Pam what that was. Is that in relation to this item, Pam?
Thanks, Chair. It was actually in relation to the previous item and around the domiciliary care issue, and hugely welcome the £23 million boost to the sector. But I think, there are lots of questions coming out of that as well, and I think it would be really important that we do have a briefing from the department on on how we're going to go forward with the domiciliary care issue. I have huge concerns around the 15-minute call-out times, the care packages, which are really just, they don't work for anybody. They don't work for the service user, and they don't work for that care provider. And I give the example of how in the south they've moved to 30-minute minimum periods of time, and apparently they're looking at a 1 hour minimum period of time. So I think it would be really important that we do speak to the Minister or the Department and actually tease out how we're going to go forward, and how we're going to properly plan to have those people in place and ensure that they are treated with respect and given proper pay terms and conditions going forward, because it's a vital workforce and they couldn't feel anything but underappreciated given the circumstances, and that's completely wrong. And I think we need to be, as a health committee, we need to be backing them and ensuring that they get what they need in order to do their jobs to the best of their abilities.
Yeah, thank you, Pam. Yeah, and I think actually, and I'll see Paul has a hand up there as well, but I think actually it also raises the issue around the true cost of care, and it would be maybe useful to check, are the department planning to publish a true cost of care to inform the consultation on the reform of adult social care? I think that's a fundamental building block, so I think maybe we'll include that as part of that letter if members are content. Yeah, Paula.
Thank you, Chair. Whenever the Minister announced the 12 million a few weeks back for social and domiciliary care, the first round of funding, I asked him for a breakdown how much was going to domiciliary care, and it only turned out that of that 12 million, 120,000 was going to domiciliary care, and it wasn't going into the pockets. It was more around PPE. So it is useful for us as a health committee to scrutinise when those announcements are made. We need to get the finer detail, because sometimes it can be very revealing. But I put my hand up particularly in relation to carers. We know again that the Minister made an announcement whenever he was sort of rowing back from the £500 carers recognition payment that he did put money into the voluntary sector. So I think it would be useful if we engage with carers, and I think they're the lead body in terms of processing the applications for support for carers. If we can engage with them to find out how they feel that the funding is being used and in what ways the department could be better supporting them to support the carers in turn. Thank you.
Yep, members content that we will write to the Minister in relation to what supports are being worked on at present to provide additional support and recognition to carers in light of the COVID situation, and also that call to engage with carers NI, and I suppose we could write to them in the first instance to find out how that has helped and what that has contributed to the very, very difficult situation that carers continue to face. Okay, thank you, members. Moving on then, members, to the draft minutes. I refer you to the draft minutes of the meeting of 18th of November at tab 3.1. Are members content with those minutes? Yep, thank you, members. And I also refer members to the minutes of our meeting of the 23rd of November, which are contained at tab 3.2 of your table papers. Are members content with those minutes? Yep, content, thank you, members. There are no matters arising then, members, from those. So that brings us to our first substantive evidence session today, and this is the first of our evidence sessions on the Adoption and Children Bill. I refer members to the written submissions from each of the organisations at tab 5 of the pack, and we are being presented evidence today from Barnardos NI, Family Care Adoption Services and Family Roots. So I would now like to welcome by Starleaf Helen Brown, who is Assistant Head of Fostering in Barnardos NI. Helen, can you hear me okay?
I can hear you. Can you hear me?
Yes, we're hearing you, Helen. Thank you. Yes. We're also joined by Maggie.
Good morning.
Good morning. We're also joined by Maggie McSorley, who's Chief Executive Officer of Family Care Adoption Services. Good morning, Maggie. Can you hear us okay? So we're not hearing you there, Maggie, just at present. So if you could just check, is it something on your end? I don't think you're muted. So maybe something else, but we didn't hear from you there, Maggie. I'll go to the rest of the panel and we'll come back and check again. We're joined by Linda Wilson, who is Interim Chief Executive Officer with Family Roots. Are you able to hear us, Linda? Okay, we're not hearing from you, Linda, either. What I might suggest is that you both sign out and back in. Both Maggie and Family Roots, I see you're both in the same room. If you sign out quickly and come back in, that may address that issue, please. Thank you.
We aren't. This is Maggie McSorley from Family Care. Can you hear me now?
I'm hearing you now, Maggie. Yes.
Excellent.
That's you.
I'm not in the same room as Linda from Adoption Roots.
Yeah. No, I see. I think both the Family Roots are in the same room. So hopefully they can get their sign. So while we're waiting for them to rejoin, I would like to welcome all of you this morning to the committee and to thank you on the committee's behalf for coming today. And I'll go back to yourself, Helen, just to check. I think each of you will make some short opening remarks and then we go to members' questions. So I'll just go back in terms of the order I have in my running order here. I'll go back to yourself, Helen, and see if you're content to go ahead with your opening remarks.
Yes, good morning. Thank you for inviting us to present to the committee this morning. Some of you may know Barnardos is a long-established charity in Northern Ireland and across the UK. We operate 45 services and manage 18,000, work with 18,000 children across Northern Ireland each year. I manage the fostering service. I have an adoption remit as well because we have just been registered as an adoption agency. I think we support wholeheartedly this bill and would like to see this having a fast ascension through the Assembly. We have fed back orally in writing some comments, and one in particular, the clause 133 around widening the definition of harm. And I think we've had wide support around that. So we're hoping that will receive positive kind of attention. But I mean, just to say wider than this is a long-awaited bill, and we are very anxious that there could be any prevention for this going forward, and we would love to just see this kind of making a very quick move through, and so our support is fully behind this bill, and really what we would like to maybe draw the committee's attention to really is the implementation of it and some sort of guidelines around how it will be put in place. Maybe just also to say that Barnardos has been working tirelessly with children and young people throughout this pandemic. We're working very hard to stand still, and we see the benefits of this bill being able to allow us some legal remit to be able to fast circuit with things like adoption support that is already in place in other parts of the UK, and support to care leavers, which again is already in legislation across the UK. So this is really just Northern Ireland catching up with the rest of the UK, and my colleagues in the UK are really excited by the prospect of this bill moving through the Assembly.
Okay, thank you, Helen. And I'll just check the sound with Family Roots then, and then I'll go back to them. So we're joined by Linda Wilson, Interim Chief Executive Officer in Family Roots. Linda, are you able to hear us?
I hope so. I can hear you. I hope you can hear us.
Yes, we're hearing you now, and you're joined by Roxanne Small, who's Project Coordinator of the TESA service, Family Roots. So thank you both, and you're all very welcome this morning. We are taking an opening remarks now from each of the attendees groups. So I'll go to Maggie McSorley first, and then I'll come back to yourselves, Family Roots. So Maggie, would you go ahead, please, with your opening remarks?
Yes, thank you. So Family Care Adoption Services are a voluntary adoption agency, and we've been operating across Northern Ireland for more than 50 years now. We assess families who would like to adopt We place children into adoption mostly on behalf of the trust. So these are children who have been removed from parents for one reason or another and can't return and need a permanent family by adoption. We do a lot of work with adopted adults and birth family members, both recent and historically. We have a Life Story project, which is funded by the Big Lottery, which is a regional service to children who are in care or from care across Northern Ireland. And we work in conjunction with Adoption Routes to provide a birth, family counselling and support service. We very much welcome the new bill, which, as Helen has said, has been many years in the making and which has been a long time coming. We particularly welcome the move from freeing to placement orders for children, and we hope that's really going to expedite the time which it takes to actually move children from the position of best interest for adoption to full adoption order being granted. We're aware that statistically Northern Ireland has a very low percentage of children placed for adoption from care compared to elsewhere in the UK, even though obviously the reasons those children actually enter the system and are regarded as in need of permanent care are the same. So our statistics are 16 children per 10,000, whereas in England and Wales it's 42 or 43 children per 10,000. And it's hard to avoid the conclusion that that is because of our extremely unwieldy, complicated and combative system in court, which also has an impact on families who wish to adopt, in that one of the purposes of the new bill is to encourage more families to come forward wishing to adopt, and the current system very much mitigates against that. So we have also put in our responses to the bill, but would like to say at this point that we are entirely supportive of the bill and really look forward very much to it being enacted and to the regulations and processes that are going to be put in place to allow that to take place as expeditiously as possible.
Thank you, Maggie. And then I'll go back across to Family Roots. Can I ask which of you are you making remarks or a presentation, Linda or Roxanne?
Yes, I'll speak and then Roxanne can join in to the committee's inquiries. And I'd like to thank the committee for the opportunity of giving a verbal input. We're attending on behalf of Family Roots. And Family Roots is a small registered charity in Northern Ireland, but we're also an adoption agency, and the purpose of the organisation is to promote the achievement of family life for everyone. So as well as adoption, we provide a range of other supportive services that support that purpose. We have a deep history in that we were originally within the body of the Church of Ireland and were placing children as long ago as the 1940s. So there is that historical perspective, and we're actually the archive for several thousand records going back to the 40s, both for adoption, but also for the Nicotine and Mother and Baby Home and the Kennedy House Mother and Baby Home. So we would provide origins and connection work as well as other services. As an adoption agency, we're actually in partnership with a UK-based organisation called Adoption Matters. So the children that we're placing in Northern Ireland come from Scotland, Wales or England, and that brings its own dimension because it gives us a familiarity with the system across the water and how that's working to achieve the kind of numbers that Maggie was referring to and that we're not actually achieving here in Northern Ireland. And while adoption is clearly a statutory matter, and we would certainly be encouraging people to go to their trusts to adopt as well, we think it's important that there are agencies like Family Care, Barnardos and ourselves bringing an alternative independent adoption service both for children and adopters. We're happy to take committee inquiries and questions on any matter. We have a specific interest in post-adoption support, given the number of fractures and breakdowns in adoption, which seems to be increasing. The sooner a support package is put in at the point of placement, which is tailored to the individual child, the better. So we're particularly keen to give focus to that. We're also very keen to give focus to the support of birth parents through the whole placement and court process, because again, that signals a much more effective outcome and sustainable outcome for the child. So, as everybody else has said, we're very much in support of this legislation. It's long awaited, and what is important now are very robust and monitored and scrutinised implementation plans.
Okay, thank you, and thank you all for those remarks, and those are useful in terms of setting the context. And I suppose one of the things I do want to say, I suppose, before we start is my thoughts this morning, and I'm sure committee members' thoughts are very much with all of those who have been impacted by the mother and babies homes inquiries, and a situation where adoptions were taking place unregulated and the impact that has across a life course and transgenerationally. And I think that's something that I think is, I just want to reflect on that. In terms of the bill before us currently, and I know that you have indicated there, Linda, around the birth parents and the need to support birth parents, and also in reference to, I think it was the remarks that you made, Maggie, in relation to the benefit of the free interplacement orders being able to be done more swiftly. Is there sufficient safeguards within the system to allow birth parents to engage on a fair basis and with quality of arms basis with the process? Is there any fear on your behalf that birth parents, the process could be seen as rushed or not providing them with ample opportunities to engage?
Well, I suppose the process has been rolled out in England and Wales and Scotland for many, many years, the process that we are about to embark on of placement orders rather than freeing. And the advantage is that it does not pit the birth parent against potentially the people they see as the adopters. It helps them move into a system whereby the process is not dragged out to that extent and is not combative in that sense. Over the last 20 years, we've developed a system whereby contact, both pre and post-adoption, has become much more of a sort of a norm and an established thing and seen as in the interests of children, much more so than in England and Wales, and there's no reason why that would change given this process. Birth parents are able to engage, obviously, through both services that should be provided to them by their trusts and by voluntary agencies through the process and from their own sort of legal advice. So there certainly has been nothing in the processes elsewhere in the UK to indicate that they're disenfranchised from the process by a move away from freeing. In fact, freeing is an extremely difficult process for birth parents because they spend so much time in court and in that sort of combative mode. And really, quite often we find in terms of trying to support birth parents that is really following the removal of their children, that is really the biggest challenge.
Okay, thank you. And actually, just if I could say to panel and to committee, if committee members know who they wish to direct a question to on the panel, please do so. If not, maybe a panel member could identify and pick up the question. If one panel member could give a substantive answer, and then only if there's additional information that anyone wants to contribute, maybe indicate just that that's the case. So in terms of a second question then from myself, how do you see the bill helping your organisations? And I will quickly ask each of you, how do you see the bill helping your organisation as adoption agencies? So we'll go maybe first to Helen, and then Maggie, and then Family Roots.
Well, it's perfect timing for us because we have just become a registered adoption agency in July of this year. So our plan is to try to bring adoption forward through our fostering service. So anyone maybe who's familiar with a fostering, often children are placed for fostering and then it can become a long-term arrangement. And really what we're seeking through adoption and the adoption process and the adoption legislation that is about to come in is that children can seamlessly move from fostering through into adoption if we have foster carers who are willing to commit long term to that particular child. And this bill will allow for that smooth transition, and we really welcome this. The timing, adoption is becoming more modern, and I suppose Maggie was talking about it there about how adoption has been operating for many years in other parts of the UK, and this is us catching up, being able to operate a more seamless arrangement for children, because this is about children ultimately. This is about providing the best outcome for children and to limit moves. Children in the care system in Northern Ireland are moving far too often, and one move is one too many. So when we can allow and when we can provide a seamless move from fostering through to adoption, where we get willing people who can step forward, then this will allow for this provision. And contact orders will also be part of what makes this work. Children in foster care are already receiving high levels of contact, and the contact will remain post-adoption, perhaps reduced, but at least that is something that we would welcome, because children do need that connection with birth, and we support that wholeheartedly. Mm-hmm. So it is a modern, adoption is not the adoption of, that you referred to perhaps earlier on in the mother and baby homes. And I hope that's part of what we need to try to put across to the public, that this is a changing situation for adoption, and we really are very eager to move this on behalf of children.
Yeah, thank you. And Maggie, anything additional or specific then to yourselves in relation to how this bill would help your organisation?
Yes, I think it's going to help. As Helen has said, it's really going to be, the focus is going to be on children and moving children through the process in a much more seamless way, so they don't experience multiple moves. It also would be, the bill also brings in a large focus on post-adoption support, and post-adoption support is going to be critical. And if the process takes less time, it means that post-adoption support services can be put in place at a much earlier stage. That supports families, that saves breakdowns down the line and children returning to the care system, which obviously is the absolutely last thing that anybody would want. We, as I had said earlier, do a lot of work with adopted adults and birth families. Like Adoption Roots, we also hold a lot of historical records, and we would hope that this bill would also acknowledge the needs of those people for services, for support, for access to information in a more definitive way than is currently the case, because our adoption legislation is so out of date. Essentially, the needs of adopted adults and of birth family members aren't really addressed in any way in the previous legislation. So we'd be very hopeful that this is going to rectify that to quite a large extent.
Thank you. And then Family Roots, anything additional or specific? I'm
just going to take the opportunity to expand further into post-adoption support and the provision that's included in the bill for that. I represent TESA, which is a therapeutic and education support services for families who have adopted, and we work with families from the moment an adoption order is approved. Our service has shown to be invaluable to the strength and stability of placements that are made throughout Northern Ireland. At the moment, this organisation and project is funded through, TESA is funded through charity funds, and we're glad to see that the provision is included now in what post-adoption support is going to look like. It shouldn't be there for a crisis moment of opportunity. It should be there and ingrained throughout the adoption process and for adopters. Children who are placed for adoption carry high levels of trauma, and so it is so imperative for adoptive parents that we establish that they are going to need therapeutic parenting support, that their child may need therapeutic input along the line, and that is not a reflection of their love or commitment to this child or to this placement. It is simply carrying the burden of developmental trauma in which many children carry through adoption. So we are very welcoming to see on the bill that post-adoption support is going to be given a rolled out nationwide approach, because at the minute it is very varied and dependent on your postcode will reflect what services you may be entitled to on a statutory footing, and it should not be that way. It should not depend on where you live if you get the support that you need to make your adoption placement work, because the reality of that is we have placement breakdowns and we have children going back into the care system typically in their teenage years after having had experienced everything they've experienced up until the point of adoption, then throughout their journey with their adopters, and to then go back into the care system at that age. We are letting down our adoptive placements by not doing that at the moment, and so we really welcome that. And we also want to impress how important it is to have a voluntary organisation involved in that, because for many, many adopters, the thought of going back to their statutory service, to their social worker and saying we are struggling with this, the shame and blame and guilt in that is far too heavy. And so what tends to happen is they wait until crisis point, they wait until it is unsafe to keep this child in the house. And so by offering a voluntary organisation like ourselves, we don't carry the expectations of that. We ensure that parents know when they approach us that this is not a reflection on them. This is simply that this is a hard parenting role. And so we want to ensure that going forward that is seen to be held, that there is a place for the voluntary service and that we are independent and stand aside from the trust, that we're not connected to them. Whilst working in collaboration, absolutely, but for parents we can be a safe place of beacon that they can come to whenever things aren't working out in their adoption placement as they had planned.
Okay, thank you. And the final one then from me is, and I know there has been several mentions there of England and Scotland and Wales, and I'm conscious as someone who represents a border constituency that very often, and we have previously heard of the benefit of kinship fostering and kinship adoptions. In our part of the world, people very often live on either side of the border, or live and marry, or have parents either side of the border, or grandparents, and all of that. So I would like your view in terms of whether this legislation would have a positive or a negative impact on exploring and developing supports for families across the island of Ireland.
As I understand it, this legislation is going to apply to Northern Ireland only, and the legislation, the adoption legislation in the Republic of Ireland is an entirely different matter, which is many, many decades even behind the legislation which we had enacted in 1987. So it's difficult to see how changes to our adoption legislation is really going to have an impact on people who potentially live in another jurisdiction. Obviously, children are placed with relatives across the border when they live in those areas, if they have birth family there. How it would work if those families then wish to proceed to adoption would be something that the bill would need to seriously consider, because essentially, jurisdictionally, it's an entirely different jurisdiction. So whereby it's actually easier for children to move from Scotland to Northern Ireland, from Northern Ireland to Wales, from Wales to England, than for children to move and be legally adopted on either across the border, because of the difference in the legislation. So unless some engagement was made between the executive here and the government there, it's hard to see how it would make a difference in that sense, legally in that sense.
This does have an impact for post-adoption support, because we place children from Scotland, Wales and England, and very often we will access the adoption fund that is bespoke to each child and travels with that child. But if we wish to access statutory support for that child, if there was an additional a need for additional therapeutic input or additional education of some sort, that is not available within our statutory context. So if we place a child, for example, in Banbridge, we can't look to the Southern Trust. We have to go back to the local authority in England, Scotland or Wales to access the necessary support for that child. So it is a broader issue.
Thank you. Helen, anything in relation to that?
No, I think that is a complex question you've just asked, and I think that would be something that would have to take, broader kind of consideration of the jurisdictions. I just on a slight aside, I am very aware of many children who are placed outside Northern Ireland, in the south of Ireland, either with relatives or in bespoke looked after arrangements. But I think when you move to adoption and the legal ramifications of that, then, the child, it's where the child often lives, and it could be that the adoption services in the south of Ireland would have to pick up that kind of application for adoption and run with it through the south of Ireland.
Okay, and thank you. Yeah, and I think there is definitely a complexity. There appears to definitely be an issue here, in the sense that if we're truly putting the child's interests at the centre of everything, then I think we need to address those jurisdictional difficulties. We need to remove barriers that may prevent a child from, rather than being moved to Wales, potentially, or for adoption, potentially that adoption, there may be a better opportunity 2 miles down, in fact on the same road, never mind 2 miles down the road. So I think that's something, that I think we should be, if they can be managed across the islands, I would hope that we can look at where it's in the child's interest, they can be managed effectively in the child's interest here on the island. But that may be subsequential or additional to this, but I thank you for your answers in any case. Thank you. So I'm going to go to members now, and I'm going to go, first of all, I'm going to go to Deputy Chair Pam Cameron, then Deborah, Colin, and then Paula. So I'll go to yourself, Pam, please.
Thank you, Chair, and thank you to the panel and to each of your organisations for your detailed and constructive evidence. It's clear from the submissions that each of your groups has significant experience and expertise in this area, and most of all have the best interests of adopted children and those in care at heart. So thank you for that. I'm going to ask my questions to Helen from Barnardos. You've noted that the leaving care services that Barnardo administers as part of the cross-cutting approach between trust and supporting people programme. So how significant will the proposal to extend support to the age of 25 operational activity, and specifically are there estimates of the additional resource that would be required?
Thank you, Pam. I don't work directly with our and don't have a remit for our leaving and aftercare service. However, I can say that I think one of our concerns around the leaving and aftercare provision is that, it brings in all aspects of a child's welfare or young adult's welfare, and that's around education, housing, in particular. And so it is not just a health and social care matter. And I suppose what I would say is that there needs to be joined up approach by the Assembly in terms of how they provide the services for looked after care experienced adults up to the age of 25. We are certainly totally behind the putting the going the extra mile scheme, which is what is in place at the moment, on a legal footing, which allows for that support in the first instance for those young adults to remain with their foster carer up to the age of 21, and provide the financial support around that. And then looking towards where that young person or that young adult will move to, and support young people through to the age of 21. Can I just say that, many young, traditionally in my experience of being in fostering for many years, sometimes young people's connections end when they leave care and they are cut adrift. And isolation is a huge concern for us as young people, as young adults try to make their way in our communities. And present themselves often again when maybe they have children of their own and come through the system again. And really what we need to do is prop up those adults, those young adults, by giving them all the support and help that we possibly can. And I think it's maybe also worth mentioning that we have done some research with Queen's University on relational permanence and within Barnardos around how important it is to maintain relationships, and maintaining those relationships well into adulthood has massive benefits for young people. So this is a holistic approach to trying to keep young adults safe and well. We've had statistics as well today on the mental health crisis that we have in Northern Ireland around, particularly with young people. But that's no different for for care leavers who have experienced trauma in their life, and they are a group of people that need all the support we can give them.
Thank you, Helen, for that. My next question was on what functions do you think do the independent reviewer officers in England perform in the context of a child support plans, and where would they fit in terms of this draft bill?
We already see part of this legislation is already has been implemented in that we have been working in good practice. So we have an independent reviewing mechanism already in place within Barnardos because our colleagues in England, Scotland and Wales already have that in place. So I am the agency decision maker for our service, but we have an independent panel that sits to and we have an independent reviewing officer. So it's really about allowing for a scrutiny of systems, and that will also be the same for adoption once that is in place. I don't work currently in adoption, I can only speak for fostering, but having independent reviewing mechanisms in place is essential for the quality assurance that we all need to assure ourselves of for good standard care provision across fostering and adoption.
Great, thank you. And in relation to the definition of harm, have you received any indication from the department about why the current provision does not mirror what's contained in the Domestic Abuse and Family Proceedings Act, and whether they intend to address this?
I don't have, and I will follow that up. I suppose our concern was that you don't have to see or hear domestic violence to be impacted by it. So I think our suggestion, I think we felt that it was already it just needs to come into this bill as an additional. It's really about broadening that term. So if there's anything amiss there, we can certainly follow that up outside this committee.
That's great, thank you. And the last one from me, Helen, you've highlighted the need for clear guidance to bodies involved in the adoption and care process. What form should that take, and should that be mandated as part of the bill?
I'm sorry. The bodies, I'm not quite sure I probably should be a bit more over that one, which answer that was.
You're okay. So that was, you'd highlighted the need for clear guidance to bodies involved in the adoption and care process.
Yeah.
So I'm asking what form you think that should take, and should that be mandated as part of the bill?
I suppose anything that allows for bodies to be represented and have a strong voice. And I mean, I think you are well represented here by two of my colleagues who have years of experience. And if we can bring the third sector in to discussions and be part of forming and implementing this bill, then I think there will be better outcomes for children because we seek to be the independent voice for trusts in many ways. So so yes, the answer is if that can be mandated for, absolutely.
Thank you so much. Thank you, Chair.
Thank you, Pam. And Deborah, go ahead, please, Deborah.
Thank you, and I want to thank the panel for your comments today so far. I'm very interested in your views regarding support for families and children, and I know that you have spoke a wee bit about that this morning. As Helen's already said, we see in the news today, you know, mental health and its prevalence in younger ages coming to the fore, and it has always been there, unfortunately, but it's no less shocking whenever you hear the statistics this morning. Obviously, it's vital that we have the right support in place during what can be a traumatic time in a young person's life. So maybe if either Roxanne or Linda could answer from Family Roots, have you raised the particular issue of perhaps what is perceived as poor access to CAMHS and what's maybe felt on the ground in terms of poor access to CAMHS for adopted children and those in care with the department? And are those barriers leading to late intervention among children with trauma needs? And then, are there any examples of wraparound services, good examples of wraparound services for families post-adoption? How do we ensure the provisions of the bill in this regard do not sustain a postcode lottery in relation to that? And then lastly, Maggie, maybe if you want to take this question, in relation to a desire maybe to see care leavers and adopted children under the age of 18 gain access to information on their birth families. How would you respond to some people who may say that this may have an adverse impact on their development and well-being? So if you want to maybe take those questions, please.
That's fine.
Roxanne will talk in a bit more detail about the post-adoption support, but just to re-emphasise, I think what we said at the beginning, post-adoption support should be part of adoption. An adoption plan from the very beginning, and in England at the moment what they have is a thing called an adoption fund that travels with the child. So right from the beginning there's access to funds there, and again the independent reviewer will have oversight of ensuring that when that child sets off on their adoption journey they will have everything, you know, hopefully, and those needs will change. And, you know, Helen's talked about adoption now is not the adoption we knew years ago. So not only is it open adoption with contact, but as young people now get into their teens, with the world opening up because of remote access, young people are out looking to have contact with birth parents and birth relatives, and it's a completely different set of challenges, and as you say, issues of identity and mental health. So we have to be moving with those changing needs, and certainly that group, sort of the 14-year-olds upwards, we're seeing come back into the system, and a system that isn't always ready for them or doesn't have the resources for them. So it's being ahead of those trends in what adoption is now, and we're very concerned about the lack of bespoke services for that post-14 age group. Roxanne, maybe talk a bit more about that.
Yeah. Deborah, thank you so much for your questions. Great questions. And I think to answer your questions around why families struggle to access services from their statutory service, and do the statutory services know? Yes, they do know, and it is a very widely reported issue. And it comes down to resource and availability. And it is that golden nugget issue again of and also because there is no standardised procedure of what post-adoption support should look like. It very much comes down to the teams who are involved. So you will, in the Belfast Trust, you may have access to play therapy for your child, but in the Western Trust, you won't have access to any of those kinds of services, and it just depends on that area. So each trust makes their own decisions on those and holds what they have as a selection of supports. They are aware of the reasons why parents don't reach out, and I attended a meeting on Friday past with the heads of adoption and fostering services across the 5 trusts, and it was reiterated around the group the value of having an independent organisation when it comes to post-adoption support, particularly for parents who are struggling with their mental health, who are struggling with the demands of parents and a child who has experienced developmental trauma, because it is exhausting, and without the resilience and the therapeutic input, it makes it very difficult for a family to not just survive adoption, but to thrive within it. We have talked about how we can help to make some of those things more accessible, and I hope that through the bill, the post-adoption support will be more of a standardised format, in that you have a selection of supports that are available regardless of where you are within the system and within location. We in TESA, we support families, we support parents in the first instance, and the reason we do that is because we are aware that if a child is struggling at home, it will be the adoptive parent who is getting the brunt of that and holding that. So we offer counselling and we offer therapeutic parenting supports, and we offer contact supports around narrative and stories to families, so that the parents feel that they can then be the best therapeutic parent to their child. Most of the time after that sort of intervention, parents will come back to us and say, actually, my child does not need therapy at this stage in their life. It was us. We didn't have the capacity to read their behaviour, to understand what the communication was that they were trying to tell us, that they had unmet needs in our parenting journey. And so by ensuring that families have access to this service, or a service that isn't just for when things get bad, it is only understanding that this will be a tough parenting role. And so by taking these services, it is not a reflection of you've waited until things have got so bad that you need help. It is actually to ensure that you don't get to that point. It's so important to take that time for yourself. It's so important to have that counselling space to talk about your expectations and hopes of what adoption is. Because as Linda has alluded to, adoption has changed considerably over time, and so children who are placed for adoption now, they have experienced typically profound trauma. They definitely have experienced attachment ruptures from their birth family. So it is important that we are letting adoptive parents know that this is not about them, this is about what's happened to their child, and making sure that therapeutic support is there to enhance family life for everybody throughout the system.
Thank you. Deborah, is that yeah?
Sorry, Chair. It was just another question I had there to Maggie, just in relation to care leavers and under the age of 18.
Yeah, sharing information. So our experience is, obviously we place a lot of children for adoption and provide post-adoption support to those families, and one of the main issues they do have is a lack of information about their children's early lives, their children's lack of understanding about why they were in care, why they were moved in care, how they ended up being adopted, why their birth families weren't able to look after them. And we have a life story project, which we have run for 8 years, funded by the lottery, and we work exclusively with adopted, fostered and currently in care young people and post-care young people. And one of their major questions is the fact that they have experienced these things in their lives. So they know what has happened, but what they don't know is why it happened, how it was allowed to happen, what happened to change that situation. So obviously there's an issue about visiting upon children new trauma, but these are children who have lived through these experiences themselves and have been separated from their siblings and been removed from their parents. And if we at 90 meet a young person of 19 who has been in care their whole life and doesn't know why, that's much more of an issue for that young person than actually having an explanation and being able to create for themselves a sort of chronological narrative of their own family and understand what the issues in their birth family were, which caused that child to come into care. I mean, obviously, it's not that people deliberately hope that their children will have these experiences, but these things do happen for reasons in the birth parents' own families, and by helping those young people, you give them a much better chance of, firstly, not repeating that narrative, and secondly, being able to understand their own story and have a sense of their own identity and where they came from. So it's done in a way that obviously is as supportive as possible. And in terms of the Life Story project, we engage with the parent or carer of the young person as well, so that they also get to understand the story of the child that's in their care and is going to remain in their care. But what young people would say is, tell me now, don't wait till I'm 19, tell me in a way that I can understand, but tell me something. The more you don't tell me, the more I worry about what is it that I have done that has caused me to be taken into care. So it is critical for these children, and in terms of post-adoption support for their families, that they're given that information in a way that they can understand, and that's developed over time, that they don't suddenly at 18 go into a social services office to read 17 files of terrible information about their lives.
Okay,
thank you. Thanks very much.
Thank you. Going to Colin McGrath then. Go ahead, Colin, please.
Thank you very much, Chair, and thank you to the panel for their update. I really welcome the progression of this bill, as it is such an important update to what is a sort of set of guidelines and laws that have been around so long without being amended, and that we do have real difficulties in the system for progressing adoptions in such a swift manner. So it's good to see that we've got this bill. It is fairly comprehensive. There's quite a lot to it, but I was just wondering if the panel had any views that are there any barriers being removed as a result of this bill that may be considered well outdated. I know from anecdotal experience with a constituent where there was an example of her weight being considered a reason that she wasn't able to progress with an adoption, and the bottom line is that really wouldn't have been an issue, and it was a case of the social services saying that there was just a rule there and that they couldn't work around it. I'm just wondering, are there other bits and pieces of rules that could be tidied up in this bill that would just make the progression of adoptions a bit swifter and a bit easier? And also maybe just with the panel, any of the panel members have any views on overseas adoptions, and do they see how there may be ways that this bill could go further to try and make those a bit easier and a bit more seamless, so that they can happen on a swifter basis?
I mean, certainly in relation to the assessment of people who want to adopt, it's very much a sort of a holistic process, and obviously health is very much of an issue, and one of the issues obviously, but just because of the circumstances in which we live and the life that we lead, and the sedentary lifestyles people tend to have, and that none of us like hopping on the scales first thing in the morning and seeing what it tells us. But I suppose what we have to bear in mind as adoption agencies is that adoption is a service for children. And it's a service for children who have already lost and are going to lose at least two sets of parents. They've already lost their birth parents. They're going to lose at least one set of foster carers, quite likely. And we need to be as sure as possible that the people with whom they're placed are going to be there to see them through to adulthood. So health issues are very much an issue. And I mean, the trusts don't have, and we don't have an absolute rule in terms of how tall you have to be, how much you have to weigh, how healthy your lifestyle has to be. But there is a medical intervention very early on, and each agency has a medical advisor, and we take their advice really on whether or not there is a particular issue that needs to be addressed. And generally speaking, say in relation to something like obesity, it is an issue that can be addressed. It's a different issue if you have somebody who has a long-term permanent disability about which they can do really nothing at all. So while I understand that obviously people do get very upset and irate, and nobody likes having attention drawn to the fact that, there may be a couple of sizes bigger than ideally they'd want to be, it is an issue that does come up, and I do understand from your client's point of view, for them it's very much an issue, and the perception of it as, well, you turned us down because we were too big. Obviously, that is very much likely to be a factor, and this legislation is probably not going to change that, in that what we're looking for are people who can parent traumatised children for the rest of their lives and for the rest of their childhood, and deal with all of the issues that that's going to bring. So we don't in any way expect any parents to be perfect, and no parents are perfect, and no families are perfect, and none of us have been brilliant parents. None of our parents were perfect either. But if there are identifiable issues that need to be addressed, there are identifiable issues, and we are going to have to continue to raise those, even though obviously for the adults involved, it can sometimes be difficult for them. I don't know if that answers your question.
I appreciate it's a really difficult and a very sensitive question and issue, but I suppose that sometimes it can be just the incompatibility with this constant message that we're looking for adoptive parents, and then that there's maybe some sort of judgment that people are going through that, as you say, they're too tall, too small, too wide, too whatever, that, you know, at the end of the day, parents come in all shapes and sizes, and therefore there would be an expectation that maybe adoptive parents might come in all shapes. It's the care that's provided that is the crucial and important element.
And that is the crucial element, and that care will be provided as long-term as possible. And you'll know just from practicing in the past how much things have changed in terms of who can adopt, age ranges, denomination, background factors, sexuality, gender. None of those things matter anymore. It's really what can you offer these children. That's the key thing. So we have come a very long way from the 87 legislation's understanding of what adopters are and should be to the current situation. And the new legislation certainly recognises that, and certainly that is very welcome. And it saves a lot of, it will save a lot of difficulty in terms of different sorts of people, for want of a better description, coming forward and being welcomed by adoption agencies to be assessed.
Furthermore to what Maggie has said, I think it's probably more important at this stage, given the work that I'm involved in, that when we look at potential adopters, we look at their emotional capacity to parent as opposed to their physical attributes in parenting. I get that it's important, and I can hear Maggie's reasons for that, and I think that it has its place. But actually, when I work with adoptive parents who are carrying their own trauma from childhood, who are going into the adoption placement, carrying their infertility journey with them at times, and they have gone down the route of adoption because they have been unable to naturally conceive a child, and some of that is unfinished business, and so they're carrying forward this hope and expectation that this child is going to be the child that they couldn't naturally conceive. It is going to fill the gap in their home that they have wanted to because they want to be a family. They are placing such high expectations on this child and on the placement, and they're carrying those feelings of loss and grief. Here within Family Roots, we offer a fertility counselling service, and it's counselling for people who are on a fertility journey, whether that's during, throughout, or after. And I think actually things like that are more important when we look at adoption placements. Is this person ready to parent? What do they have in their history that they're holding that may trigger in this? Because actually, as Maggie has indicated, these are children who come with trauma. Their behaviours and challenges are exponent compared to children who haven't experienced some of those things. And so for me, when I work with the parents that we work with, I see it time and time again that actually these parents could have done with some therapeutic input, some counselling around their own parenting stuff, around their own childhood experiences, before we ask them to parent children who have high levels of need. And Colin, furthermore to your questions on overseas adoptions, we in Tessa would have quite a considerable amount of families who have adopted through inter-country adoption placements. Thailand, Vietnam, all of those sorts of places. When families bring these children to Northern Ireland, there is no support for them afterwards. Parents will phone me and say, my post-adoption social worker in my area has said, you are not our responsibility because we did not place that child in your area. And so the only option is to come to a service like ours, because they are the bottom of the order in terms of importance of providing post-adoption support. Trusts will support families that they make the placements, then it'll be families in the area. Unless there's a crisis and you're an inter-country adoption placement, you're very unlikely to get any access to any services.
That's very interesting. Thank you for that, and I'll maybe follow up with you afterwards to see maybe if there's ways that we could try and look at changing that or helping that. But that's great. Thank you very much, Chair. Thank you.
Okay, thank you. And Paula Bradshaw, go ahead, Paula, please.
Thank you, Chair. Thank you, panel, ladies, for coming to committee today. I have 3 questions this morning. The first one is in relation, I think, possibly from Tessa. I think this question is directed to you. And it's really about how this bill could be strengthened You talk about the wraparound support for parents sort of in the family unit, but I'm just wondering, is there any ways that this bill could be strengthened in terms of other parts of public services, like in education or youth services, or within churches, sports groups, or community groups? Because it's one thing having a sense of settlement within a new family unit, it's also another thing then being accepted within your local community. And I'm just wondering, and your education community too, just wondering, is there any ways that this bill could be strengthened to make that transition into full-time adoption and placement easier for the child?
Yeah, absolutely, Paula. I think we are becoming more aware as a society that people in general will carry their stories with them, and it impacts on how they behave and how they are on an outward journey. So when you mentioned sports clubs and drama clubs and church clubs, all of these sorts of services that all children should have access to, for adopted children, they struggle to access these because of how that behaviour comes out. That when children have experienced early trauma, they generally don't have the verbal capacity to put words to it, so it comes out in behaviour. So whenever we are talking with our families, with our educational supports that we put in place, we are really trying to convey the message that behaviour is communication, and what is it that this child is trying to communicate. We want to raise awareness of the impact of trauma and what that looks like on a child, instead of branding these children as the bad children or the naughty child or that child's a nightmare and they're not coming back to this group. Actually, this child needs this group, probably more so than most other people here, because they retain the opportunity for peer interactions and socialisation is so vitally important to the development that has been missed out in those early stages. So if we could try to implement an awareness and understanding of the needs of children who have experienced trauma, and this does not just relate to children who have been adopted, this is children who stay within their own placements and have had a trauma in early childhood, perhaps illness, parental disability. This is not just specific to adopted children. Whenever we provide our education training to schools and to classrooms, it is based around how to best support the needs of an adopted child in the classroom. It is done with one child in mind who will be an adopted child. At least 60% of recipients of the teachers who do this training will come to the project afterwards and say, I can think of 6, 7, 8, 9, 10 children in my classroom who display these behaviours, who will benefit from this training and understanding. We want to put the child to the forefront of everything in any service that interacts with these children, to recognise, don't look at the behaviour, don't look at the challenges, what is this child trying to communicate with you? And it will all come back to attachment and trauma, and we know that, and so we want to make that a mainstreamed supportive level. We would like to see the likes of our education support programme implemented at teacher training level, way beyond even schools. We want to take it right back down to the core, because actually being trauma informed will only benefit the lives of children throughout Northern Ireland. And particularly children who are care experience and trauma experience and who have been adopted, absolutely, but all children, everybody will benefit from a trauma-informed classroom, a trauma-informed youth centre, a trauma-informed youth leader, somebody who speaks the language and who gets it.
That's very helpful, thank you. Two very quick questions then, I think possibly directed towards Barnardos, but I'm happy for other people to jump in. I'm looking at a possible amendment to this bill, and it's around the removal of the defence of reasonable chastisement. You'll know the equal protection from assaults is now in place in Wales and Scotland. Effectively, it's removing the defence that you can smack a child as opposed to introducing a new offence. And I'm just wondering if you feel that it would be appropriate that we would, as a committee or me as an individual, would seek to bring about that legislative change at this opportunity. Sue, do you want to comment on that? And I'll finish with my final question.
Yes, absolutely. I mean, traditionally fostering, particularly, I mean, we have a no smacking policy and has been in place for ever, I think. So this just really brings it into line in terms of policy. I'm hearing myself coming back there. I'm not sure if I'm coming across okay for you. There's a kind of an echo in the line. But yeah, just to say that would fit very well with our expectations around fostering, and certainly adoption is a slightly different ball game, because once a child is adopted, they are the legal responsibility for they have legal responsibility the doctors have legal responsibility, but and would fall into place with any parent and how any parent behaves towards their child. But I think it's become less and less palatable form of chastisement within the home, and I think we would certainly be supporting any change to the law that would prevent parents from smacking or hitting their child, largely because it cannot be measured. What is a smack and what there is no way to determine when that would move into abuse. So we would have to be saying no to smacking.
Sorry, just to be clear, my question was in relation to any parent, regardless of whether they're adopted parents or whether they're the natural born parents. I'm not sure the proper terminology, but I just think it's just an opportunity when we're talking about adoption and children, that I think it's an opportunity for us to bring ourselves in line with other parts of the UK. I think Ireland are in the process of doing this. So
yes,
it's something I'll continue to pursue. But just to Helen, just to come back in terms of the post-adoption service helpline that Barnardos introduced whenever the mother and baby homes report came out, and I congratulate you on the speed at which you set that extended service up. And I'm just wondering, is there any way that you are looking at analysing the sort of feedback from those adult adoptees about, I think people probably have an understanding now of what it is like to go through the adoption process, but adults who are maybe 20, 30 years past it, around the emotional impact of an adoption. I'm just wondering, are you analysing the sort of information that you're picking up on your helpline at present? Thank you.
We will be seeking to look at evaluating that. I have no data to hand on that, but certainly if that has been gathered to date, we can get that through to you, Paula. But the See Hear Respond, I think, service you're referring to has been very successful and very needed during this pandemic. And something we're very proud of within Barnardos. It's been rolled out in Northern Ireland and across the UK.
Thank you.
Okay. Thank you.
Thank you, Paula. And finally then, Orlia Flynn. Go ahead, Orlia, please.
Yep, thanks very much, Chair. So it's an issue that was in the Barnardos briefing paper, but it's maybe a question to each of the panel. So conscious of the scale of this bill and that it is going to be very difficult, logistically and financially to try and implement all the changes at once. So Barnardos, you have made the point in your briefing paper that you are keen to understand how the department intends to prioritise the changes in the legislation, and I'm just wondering to get your viewpoints on that. Has your local organisations gave any thought to that? I know that obviously everything contained within the bill is extremely important, but just in your opinion, would you have any sense or idea, even to advise the department at some stage, how you would intend to prioritise what's contained within the bill?
Oh, well, I mean, post-adoption support has to be top of the list because the headlines today, as we've already referenced, mental health issues amongst young people is soaring in this country. So I would say if there was to be a priority, it has to be about organising ourselves to provide the post-adoption support and the funding that goes along with that, because Linda, I think, made reference to funding being attached to the child post-adoption, and that funding, could then be accessed for each individual child. So I would say we would be totally behind that being one of the key priorities. But implementation is huge in this, and we recognise there's a lot in the bill. So having some kind of a timetable and programme that is laid out, that that includes the third sector, the independent, the people on this call would be most welcome, because as I've said, we have a wealth of experience and we can bring our experience to bear in terms of how that is implemented. So we would really welcome how that can be laid out in a staged way, with timescales, ideally. So I hope that answers your question.
Okay. I'll go next on that. I think your question's the key question, because underneath this policy development, legislation development, there's a gap, because there are services which are managing at the moment hand to mouth, and services which have been very well evaluated for their effectiveness. And in this gap, while we're waiting for implementation, some of these services could go. Post-adoption would be top of my list. At the moment, we're managing totally on lottery funds on that. Those are coming to an end at the beginning of the year. We're going out to fundraising. That should not be the case, that a service which is an integral part of new legislation should not be at that level of risk, with the voluntary having to look for charitable funds. So there's work like that. There's work like the next steps, which Maggie and ourselves share as a project. The procurement on that has been delayed now for months and months. The contract only runs to December, so there is a gap, and in that gap, we'll actually be worse off before we actually start. Over the last probably 10 years, the department, the executive have invested significantly, both time, attention and money, in outcomes-based accountability and effectiveness. And I would like to see the implementation of this legislation be subject to that in a rigorous and real way. That at the end of the day, what are going to be the outcomes for children, and how is the implementation going to take the spirit and the body of the law to make sure that that happens? So effectiveness, outcomes-based accountability, and don't let's throw services out that in the meantime while we get the plans in place.
Okay. Yeah.
Okay. Sorry. I just wanted to reiterate really what, in terms of priorities, what Helen had said about post-adoption support. Post-adoption support is going to be critical and is also going to be expensive. So I think that's very much a priority, in addition to actually moving the process on from freeing to placement orders, so that children can be moved much more quickly through the system where a proper decision has been made that they should be adopted. Those would be really the two priorities that this bill you would need to focus on it from the standpoint of an adoption agency, and how that's going to actually help children to get more quickly into new adopted families, which are going to persist for them through their childhood.
Thank you very much.
Okay, thank you, Orlia. Okay, members, thank you. That seems to be all the questions for now. So I'd like to thank the panel for attending committee this morning and for your contributions to it. And obviously you have a very, very unique and a very focused perspective, which has been really useful for the committee. So I want to thank you all and wish you all the very best, and we can continue on with the session then and allow you to drop off the session. But thank you and take care.
Thank you very much. Thank you. Bye-bye.
Thank you very much. Okay, members, so that's been a useful first evidence session in relation to this issue. A few issues are raised in there, and actually I just do want to mention, I suppose, the fact that the Minister, and it's in tabled papers, we'll come to it later in correspondence, but the Minister has indicated that he is going to look at an amendment to secure records for those who have been previously within the mother and babies issue. So I think that's relevant and useful, and a very welcome step that the department are going to take that forward. The other issue I wanted to raise was, would members be content that we write? I am concerned about the response there around the issue of kinship Chair, and particularly potential for kinships adoptions here on the island, and particularly in border communities where people, as I said, literally might have an aunt or an uncle or grandparents on the same road or on the same farm who would make excellent adoptive parents in terms of socially and culturally and relationshiply, and that appears to be rather under-considered in my view, and the arrangements don't seem to be brilliant, going by the response we got from the members of the panel. So would members be content to be write to the Department asking what interaction the Minister or his officials have had with the Health Department in the South regarding the possible impacts of cross-border working for adoption arrangements and supports ongoing flowing from this? Members content? Yeah, thank you. Any other thoughts, members, or anything else? Colin, I see you have an indication there.
Thank you very much, Chair. Chair, I was just wondering maybe that issue about overseas adoptions, that there just seems to be maybe an approach of, you know, that adoption didn't happen through us, so we'll not provide any support or help, or and I suppose maybe, I'm sure there's probably other legislation, but I'm a bit concerned that there just seems to be like a hands-off approach if it happens from overseas, and that maybe that's something that, you know, we could look at maybe saying an amendment maybe to say that there should be at least some assessment done to see what support is required if there are people identified overseas. But could we write to the department and at least ask them what the current practice is for overseas adoptions, and then maybe we would see from the response whether there's something that we could suggest in this bill?
Yeah, and I suppose I should point out the fact we have raised this issue previously, because actually any adoption processes, my understanding is, from the 26 counties is treated as an overseas adoption. We have received further information from the department and in relation to that, but I think it's particularly relevant that we could see a situation where that is the case, despite someone adopting someone who literally lives on in the same townland or very close by. So I think that's relevant to that as well. I also see an indication from Paula.
Thank you, Chair. I was just to ask the committee clerk there to take a note of the potential amendment that I referenced. I'm happy to send them some information through it. It's a very, very short amendment, and I think it'd be very worthy for us as a committee to give it further consideration as we go forward. Thank you.
Okay, thank you. Okay, members, thank you. That brings that session to an end there. I'm going to take a very, very quick comfort break there just for people before we go into the next session. So if we could ask people to come back there at 11, restart again at 11. Thank you.
Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound.
Okay, thank you, members. So I'm now resuming, and we're moving now to item 6, which is in relation to organ and tissue donation deemed consent bill, and specifically with the department's response to that issue. Members, following on from the evidence sessions with stakeholders on 11th of November, officials from the department are here today to respond to the issues raised. I refer members to papers at tab 6 of your pack, which include the clerk's memo at tab 6.1, the official reports of the bill, evidence sessions at tab 6.4 to 6.6, and a research paper on the bill at tab 6.7. Also included in the table pack at tab 6.8 is a response from the Minister to the key issues raised during evidence. So I'd now like to welcome via Starleaf Mr Ian Plunkett, who is Head of Organ Donation Bill Team. Are you able to hear us there okay, Ian?
Yes, Chair.
Thank you. And Ryan Wilson, who's Director of Secondary Care. Are you able to hear us okay, Ryan?
Yes, Chair, thank you. Can you hear me?
Yep, we're hearing you both there. Fine, thank you, members. So we'll go ahead then and go back to yourself just to check which of you are going to, or both of you are going to make some opening remarks, but I'll check with you, Ian. Who's making the presentation? Ryan. Okay, Ryan. So listen, I'll go straight back to yourself, Ryan, if you want to go ahead. Thank you.
Thank you, Chair. Just a few brief opening words. So thank you to the committee for the opportunity to come back and discuss the bill with you. Ian and I were grateful to provide our introduction to the bill on the 9th of September, and we have followed the committee's evidence sessions with some of our partners and stakeholders that took place on the 11th of November. So following that, as you mentioned, the Minister has provided the committee with a detailed response to the range of issues that have been raised to date. We hope that has been helpful, and Ian and I will be very happy to elaborate further on any of those points or other questions that the committee may have at this stage. So just to conclude briefly, we're very aware that this bill is widely supported, and we want to assure the committee that we are planning, along with our delivery partners, to be in a state of readiness from next March to go into 12 months of intense preparation and planning in terms of communication and training in order for the deemed consent provisions to go live from March 2023, if that's what the Assembly decides. So I'll pass it back, Chair. Our detailed responses in the Minister's letter, and we're happy to pick up on any of those points.
Okay, thank you. So the response states that there are 4 additional specialist nurses for organ donation would be required. What would be the additional funding requirement for that element of the future service?
So, I'm going to pass to Ian for that. Ian's the bill manager, as you said, and is in the process of putting together our business case for the overall investment that we think will be necessary. So Ian can give you some of the details on the anticipated costs of that.
Thank you.
Yeah, we're anticipating that the 4 additional staff required to run the new system will be about £212,000 per annum rolling forward. So again, that'll help with the resilience of within the current team, and then 2 more additional staff on top of that, just to make the system work once the new update system comes in.
Okay. Thank you. And the other thing I suppose I wanted to check with you in terms of, and I know that there are certainly at times have been offers made, I think either way in terms of across the border, but also across Europe, that there are times when there are European adoptions or European organ donation is possible in certain circumstances, and that situation does arise. Are there any additional implications emerging or flowing from Brexit that could create difficulties in that respect, or is there anything within this bill that has been explored in terms of across the island here that will streamline the process in that regard? Ryan, please.
Thank you, Chair. I'll take both of those questions in turn. I think in the evidence that you heard from NHS Blood and Transplant a couple of weeks ago, I think they provided some detail on the level of planning they did in the lead up to EU exit, and their experience really since the UK has left, and the main message is that there hasn't really been any impact in terms of donation and transplantation. The way I think the committee will understand at this point the way that the organ allocation system works. So if there are occasions where an organ is not able to be used within the UK pool, it is then offered to neighbouring countries, beginning with the EU, and on occasions they are accepted. So those networks and pathways are really well established at this point. And we, to date, haven't seen any impact that Brexit would have. There is some planning going on in the department at the minute in terms of developing what's known as a common framework for organs, tissues and cells, and that's really to set a framework around the quality and safety standards for the movement of those materials. But there's nothing within this bill or the proposals that are within this bill that would have any impact on that. And I think just to get to the detail of what will change as a result of what's being proposed is really the focus of and the emphasis of the donation conversation that will take place with the families of potential donors. So no, in short, we're not anticipating that there'd be any impact really as a direct result of Brexit. You asked as well about the extent of collaboration with colleagues in the South. We have over the years had good links at official level with colleagues in the Department of Health in Dublin around organ donation and looking at opportunities just for collaboration at a clinical level. We have in the past that has led to the arrangements which enable some residents in the Republic of Ireland to avail of the kidney transplant service in Belfast occasionally. So that has worked well too. The committee may be aware that there is a journey that is ongoing in the Republic of Ireland towards legislation around organ donation. It's starting from a different starting place than ourselves because it really is covering a whole range of issues around organs and tissues, which in our case would be already covered by the Human Tissue Act 2004. So part of that is the introduction of deemed consent provisions in the South for the first time, but similar in terms of objective, I think, of moving to a place of deemed consent where possible, but a different starting point. So we've agreed to stay in contact with colleagues as they develop that. I think they're looking to bring a bill to the Dáil in the early part of next year, but that's a much more wide-ranging piece of legislation than ours.
Okay, thank you. And the final one from me then, Ryan, and it's really prompted, I suppose, by the fact that you mentioned cell donation there. Is stem cell donation and transplantation included within the scope of this bill? Does that fall under this bill?
No. Stem cells is it's a related issue in terms of the fact that it involves donation for the benefit of people who have blood cancer and certain blood conditions. So there are occasions where family members or non-related people can donate stem cells to help those people through a transplant. It's a separate service and it takes place within haematology. In Northern Ireland, it's based within the haematology service in Belfast City Hospital. The department did in September run some promotional and awareness campaigns around blood cancer awareness, which included some information about stem cells. It's a different message, I think, just to put it in simple terms. I think there's a level of public awareness around that issue, which is probably at a different place than public knowledge around organ donation. So there's reasons why we don't sort of promote the two issues together, because there's different set of behaviours and learning that need to be addressed in terms of stem cells. But it's not an issue that would be covered within this. In this legislation, we are talking specifically about the donation of organs after somebody has died, which you'll be aware is in very rare circumstances to begin with. So hopefully that answers your question.
Yes, thank you for that clarification. That does answer that. I will then go on to members' questions. So I'll go first of all to our Deputy Chair, Pam Cameron, and then at this point I have Deborah and Carol both indicating. So go ahead, Pam, please.
Thanks, Chair, and thank you, Ryan and Ian, for your attendance at committee today. I've a couple of questions here for you. I wanted to ask you around the inclusion of those usually resident in Great Britain who die in Northern Ireland in the scope of the bill. So does that present practical and legal difficulties? So how would someone's eligibility be proven and what arrangements would need to be in place to consult family members who live in other jurisdictions? So would these factors cause delays and ultimately make donation in a timely fashion unfeasible? That's my first question.
Sorry, can I just clarify, your question is around somebody who's not resident here but who may die in those circumstances and their family lives elsewhere?
So it's the inclusion of those usually resident in Great Britain who die in Northern Ireland.
Okay, so just to relate that to the proposals of this bill, those people wouldn't fall within the proposed provisions of deemed consent in those circumstances. So if they are not usually resident here, and this is one of the questions that we consulted the public about, we are saying that it should apply to people who are usually resident, and there's certain tests that would be met for those criteria to be applied. That doesn't mean that those people can't become organ donors, and it comes back to that conversation with families or with people who are in a qualifying relationship. So we I suppose want to give an assurance that already happens, and that would continue to happen under deemed consent provisions. In fact, that's a really essential part of the pathway, is that for deemed consent to apply to anybody, there needs to be that conversation which would ascertain the person's last known decisions or otherwise, because consent cannot be deemed in those cases. So if the family happens to live in GB or in another jurisdiction altogether, every effort would be made to make contact with that person's family and loved ones. In the rare occasion where there's no contact, or there's no ability to trace somebody who's related, then organ donation won't proceed. And it doesn't proceed at the moment, and it wouldn't under these provisions either.
Okay, that's great, thank you. And what research was undertaken when scoping the bill in relation to the capacity of 16-year-olds to provide informed consent for organ donation? So was one of the factors in the decision to exclude this cohort the likelihood that it would present a precedent for other forms of public participation? And could you tell us what stance other UK regions have taken in respect of this?
Okay, so that was a question that we included in our public consultation as well, in terms of which groups should come under deemed consent and which groups should be exempt. So we have essentially followed the path that has been taken by other regions of the UK, and specifically England and Wales, which are covered by the same legislation as ourselves, which is the Human Tissue Act 2004. So that is the act where the age of consent would apply. So you may have picked up in the consultation response, there were in total 37% of the respondents to our consultation who thought that the age group should be lower, and some of the comments would indicate that they were aimed specifically at the 16 to 18-year-old group. So we know that there are some within that age group that would support that. So I think we want to be really clear that, firstly, anybody can join the organ donor register, and any age group can. and anybody can become an organ donor after their death. So, I mean, we would absolutely agree that people in that age group, specifically 16 to 18, are capable of understanding this legislation and what organ donation is about. But what we're talking about is the whether or not deemed consent should apply to those people, whether or not their consent should be presumed in the absence of an affirmative decision during their lifetime. So that's a slightly separate question, and in that sense, we're in keeping with the other nations, and it may be something that could be visited in the future if there's an overall question around 16-year-olds generally, and in terms of wider rights and voting and things like that. That could always be something that could be revisited. But I mean, I think really for practical and technical reasons, it would be difficult to be at variance with other nations which are governed by the Human Tissue Act.
That's great, thank you. And finally, from me, I wanted to ask if there was, is there currently a mechanism within the bill to ensure that regulations can be brought forward to add donations to the scope of deemed consent should the technology or techniques advance in coming years?
I'm going to ask Ian to address that one, which would be over the detail of the bill itself.
Ian, just before you come in, could I ask everyone just to place themselves on mute there? There's some background noise coming through, so go ahead now, Ian. Thank you.
Yeah. Sorry, I just had my dog going mad here, but hopefully they'll settle down.
So that's where the background noise, that explains the background noise.
Sorry, apologies. Sorry. So, sorry, could you just repeat the question again? Completely distracted there.
Sure, no problem. I'm just glad it's not my dogs barking for a change. So what I was asking was if there's currently a mechanism within the bill to ensure that regulations can be brought forward to add organs to the scope of deemed consent should the technology and techniques advance in coming years.
Okay. Yeah, we should this legislation go through, we're anticipating bringing forward secondary legislation sort of immediately after we get approval on this. And that will specify what organs and tissues are included within the deemed consent. And then what that leaves us the option then that if any of the other organs, tissues become normal sort of for donation, then we can go through the process of adding to that list as it goes along. If that's covering, yeah.
Yeah, that's perfect. Thank you very much. Thank you, Chair.
Thank you, Ian, and thanks, Pam. And going then to Deborah Erskine. Go ahead, Deborah, please.
Thank you. Thanks, Ryan and Ian, for coming to the committee today. Sorry, it's just getting a wee bit of feedback there. Can you hear me okay?
We're hearing you okay. It's a bit poor from people who are in the rooms here in the building. The sound is a bit poor, but we are following you. But if you just be as clear and as slow as possible, Deborah, please.
Okay, no problem at all. Look, it was just really, the chair there had asked a question in relation to staffing and things like that. Will the resource requirements of this bill disproportionately impact certain trusts given the specialised staff and functions needed? Was a resource needs assessment conducted prior to drafting, and how will the lead-in time account for any preparations that are necessary?
Thank you, Deborah. I'll maybe start that, and Ian can fill in some of the details around the way in which the resources are being accounted for in our planning. So, just to describe the infrastructure or the resource that is currently in place. So, organ donation can come from any of our intensive care units across the system. We are anticipating that through these measures, we might see an increase of around 10 to 15 donors across those units per year. So, in terms of how that resource would be spread or impacted across the units, we're talking about people who are already admitted to ICU for various injuries and conditions. So there's not an additional impact there in terms of numbers. The main impact is in terms of the specialist nurse team, which is an existing network of specialist nurses whose role comes in at the end of life and during that conversation with families, and that's where we would initiate the donation conversation, and following from that the retrieval process. So the main impact, I suppose, is in terms of increasing resilience within that team, that network of specialist nurses. And we have said our plan and assumption at the moment is that we think an additional 4 nurses to that team would be appropriate. So it would be up to the team management really how they're spread across the units. There's obviously units of different size, but a donor could come up in any of those units, and as far as I know, the team works across the region and works across units. Some of you asked then about the resource needs assessment. So that's work that's ongoing at the moment alongside this bill as part of our business case process. So there are certain elements that we think will need additional investment. The specialist nurses is one of them. We think there'll need to be some upfront investment in terms of really intensive public engagement and education for 12 months before we go live, and for 12 months after that, and into the future there will be ongoing public engagement and awareness. So those are elements that we are factoring into business case planning, and then with that increase that we expect, there will obviously be further demand on the UK-wide retrieval teams who come in when there is consent given. So we would envisage increase incrementally, along with the increase in the consent rate. So all of that's been factored into the planning and the business case which is underway. So Ian might want to just add more detail in, or maybe just check if that has answered your question or if it's on the right lines.
I think what we sort of, we said about disproportionate across the region, there is 10 ICUs across the region in Northern Ireland, so we can't really tell where the services is going to be needed. So the SNODs will go where they're required. Obviously that will involve a cost, but we're sitting here, we can't determine where these costs are going to be spent. And it'll be on a case-by-case basis where the additional funding is required to deal with the situation and where it arises across the region.
Yeah, I mean, I think, for me, 4 additional staff just doesn't seem that much, if we're expecting loads more to then be coming into System 4 organ donation. And I'm just wondering, if in future years we're going to need to see more additional staff. And I suppose it's one of those things where it's going to have to be a wait and see, isn't it? In terms of, how we see the rollout of this and whether we are going to need additional staff. Has there been any sort of forward thinking, say, for 5 years' time, say, are we going to need additional staff, or the outworkings of it as well?
As you know, the NS Blood Transplant are really responsible for running the whole organ donation network, and that has been factored into all the costs. We're looking at the costs based on their figures over the next 5 years as a minimum, and they are constantly looking at what is required, and potentially it could, potentially the requirement will increase over time. We're looking at it over the next 5 years and what the impact's going to be there. Obviously, even if you look at it in staffing terms, you're going to lose staff just through natural wastage and things like that. So NSBT are constantly looking down the line to see what do we need to do. Do we need to start recruiting additional staff? It might be replacement staff rather than additional staff. We're looking at sort of between 10 and 15 additional donors per annum, and we have assessed that at 4 nurses at this stage. But as you say, we can't determine beyond that. But we've looked, and our figures are based on what we think is realistic over the next 5 years.
Okay.
Yeah, I would, sorry,
go ahead, Ryan.
You know, we obviously recognise there's huge pressure on intensive care, and has been for the last 2 years almost. So that I think just to put that into context, we know that probably the overall critical care system for Northern Ireland is in need of additional resilience. But what we're talking about here, just specifically to relate it back to the potential pool of organ donors, it's a very small number, and I think in the previous evidence sessions, the committee will have heard that we're talking about 1% of deaths that take place in Northern Ireland or across the UK that happen in those circumstances where donation may be possible. And from that, you then have to, that number becomes even smaller when you factor in things like clinical contraindications. So we're talking about people who are already admitted to ICU. It's around about 80 people per year. Currently, we have about 40 to 50 of those who go on to become deceased donors, and we're talking about bringing the consent rate up within that very small pool from around about 65% to 80% or better if we can. So in numbers terms, that is small. It's small but very significant when you think of the lives that can be improved and saved by their donations. So that's the target. So just to go back to Deborah's question, it's not an additional pressure or impact than what we see already in the intensive care units. It's converting those potential opportunities into consented donors, and that's where the additional resource will be needed within the specialist nurse team. So the additional 4 really will build a lot of resilience into the existing team. I think you heard as well about the level of expertise and experience that we're lucky to have in their small team in Northern Ireland. So it would be adding to that and building to it for the long term. And of course, we would keep that under constant review with our colleagues in NHSBT in case there is additional need. But for the moment, we think 4 would be sufficient.
Thank you. Okay, thank you, Deborah. And moving on then to Carol Nicotine. Carol Lanneray Littahall.
Thank you very much, Chair. Thank you, Ian and Ryan. Ryan, you finished off by saying everyone's trying to achieve the world-class standard of 80%. But the issue that we all have is that there has been a huge workforce planning issue. And while it is bespoke specialities, one thing that I was just wanting to tease out a bit more, for example, the duty on the Minister in Wales is to provide specific and/or bespoke resources. Maybe could you answer, are there plans as part of this come through that the Minister would have that as part of the legislation? And given the fact that we're still we're still in a pandemic, it's really around the role of the intensivists that are needed as well. Is that included as part of the team needed for organ donation and transplants? Thank you.
Thank you, Carol. In relation to the duty that was placed on the Welsh Minister back in, Wales, as you know, was the first of these nations to introduce deemed consent, and their bill went through in 2013. So it was the first of its kind, and that would be the reason why there was provision within the legislation, just to ensure that it was backed up with the necessary resources. Our position really is the creation and the existence of a new statutory duty around deemed consent brings with it a responsibility to provide the resources. Combined with that, we've just entered into a new 10-year strategy with NHS Blood and Transplant, which is really to take things to the next level. You will have heard before about the foundations and the infrastructure that was put in place from 2008 after the task force made its recommendations, and that is really where the level is at now. The new strategy is bringing that to the next level, and deemed consent is one measure within that strategy that we think will bring us to 80%. There's a lot more within that as well around organ optimisation, utilisation, continuing to build on the public education and the clinical education. So there's a whole range of measures which we have a strategic commitment to, as well as what will become a statutory requirement. So for that reason, I don't think, and the department wouldn't really support putting into legislation something. I don't think it's necessary, but it wouldn't. I'm not aware of any other area in our public health system where we make statutory regulations around ring fencing resources, because the duty will come anyway. So hopefully that answers that.
Yeah, Chair, it's just having been at two departments myself, I often find it interesting when you're put forward with what is known as inescapable budget headings. And I just, find that unless you have a ring, so if he's not put it in legislation, which is what you're saying, it does need to be ring fenced on proportion or percentage. Because if it's not there, then it doesn't happen. It's like safe staffing legislation. Despite all the commitments, if we had had safe staffing legislation, you mightn't have had some of the mass resignations in the ICU and the Royal. And I don't know what the reason for those are. But the point I'm making is that if it's not in legislation, sometimes it doesn't happen. And that's where my concern is, to be honest.
Yeah, and if I can pick up on that point, I appreciate the concern, because we deal with terms like inescapable quite often as well. But I would relate this back to the existing statutory duty that the department has, going back to the Miscellaneous Provisions Act in 2016. And that's when the committee previously considered this issue. But what came out of that was the duty on the department to promote organ transplantation. And we do have, as a result of that, a protected budget, which is what has enabled us to really set up the what we would call the infrastructure around the promotion and education side of organ donation. You heard from Catherine in the Public Health Agency a couple of weeks ago around the communications programme which she coordinates, and that has really been brought about by the fact that we do have a dedicated budget for that, and that's protected, if you like, within the Public Health Agency's very wide range of responsibilities, and is really, after almost 2 years now, beginning to gather real momentum and make real serious headway by bringing together all of the existing good work into a combined programme. So for that reason, I think we can be confident that this area is relatively safe in terms of how it will be prioritised.
Okay, thank you. Is that anything else, Carol, from yourself? No. Okay, members, thank you, and I want to thank Ian and Ryan for attending and for giving those answers to committee queries. That has been very useful, and we can continue on with the session now. We can let you gentlemen go. So thank you for attending here this morning, and we'll continue on with consideration in committee. Thank you.
Thank you.
Okay, members, thank you for that. So, members, next week we will be moving to considering whether members wish to bring, or committee wish to bring, any amendments, and we'll be seeking initial views on the clauses of the bill. So it would be really useful if members could come prepared to make decisions next week, and in support of that, if members are thinking of any issues, certainly bring them next week. But if members are in a position to forward them to the clerk in advance of that, he can have some pre-checking done with the bills team. So just to flag that to members, that we are moving on to our more focused consideration next week. And if members have issues they wish to consider, want the committee to discuss, or want the committee to consider making by way of amendment or in terms of report or whatever, that would be, the more advanced warning we have, the more advanced information we have, the better we can facilitate that process. So members content with that? Yep. Okay. Thank you, members. So I'm going to move on now to item 7, which is the Autism Amendment Bill. And today we're receiving a response from the sponsor of the bill. Members, following on from our evidence session with stakeholders, the bill sponsor, Pam Cameron, will now respond to the issues raised during the evidence sessions. I refer members to a copy of the bill and the explanatory financial memorandum at tabs 7.1 to 7.2 of your pack. So I would now like to welcome by Starleaf Pam Cameron, MLA, Chairperson of the All-Party Group on Autism and the bill sponsor. Kerry Boyd, Chief Executive of Autism NI. Kerry, can you hear us okay?
Yes, I can.
Thank you, Kerry. Kelly Maxwell, who's Director of Family Support in Autism NI. Can you hear us okay, Kelly?
Yes, I can.
Thank you. And Arlene Cassidy, Special Advisor with Autism NI. Arlene, can you hear us okay?
Doesn't seem Arlene's on the call, Chair.
Okay, we don't appear to have Arlene on the call at present. We'll keep an eye out for her and we'll check back. But initially, I'll go back to the sponsor of the bill to outline how they wish to brief the committee. So, Pam, will you go ahead and outline how you're going to brief, and then we'll go to members' questions.
Thank you, Chair. And yes, I suppose I should officially declare an interest as a member of the committee, and that during this item I am the bill sponsor, speaking as bill sponsor, not as a member of the committee. And I thank Kerry and Kelly for both being here, and hopefully Arlene will be on the system soon. So I was just going to make some comments, and then we are very happy to take questions after that, Chair, if that's all right.
Thank you.
Okay, so at this point I just want to thank the committee for giving me the opportunity to speak today as the Autism Amendment Bill sponsor and respond to the evidence session on the private members bill from last Thursday. And I just want to point out that we haven't had very much time to consider the evidence that was taken since last week, and we haven't yet gotten a hold of Hansard. So I just want to put that on record. So I wanted to thank the professors, Professors Lawrence Taggart and Roy McConkie, for their incredibly helpful contributions last week, their commitment to be in attendance, with Professor McConkie joining us from South Africa. I think it was very much appreciated. And I want to briefly address some of the points raised by the professors in their submitted evidence and the committee discussion. So the professors welcomed the bill's proposal of the creation of an autism reviewer role, and they clearly set out how areas such as the commissioning of independent research to inform evidence-based practice could benefit from an independent scrutiny mechanism. Ensuring existing research is utilised, existing practices are assessed, and ensure good practice is shared across Northern Ireland. I was concerned to hear the researchers report some of their experience of missed opportunities, and I welcome their overall support and conclusion that the bill has the potential to reboost more effective and efficient services to autistic people. I want to also thank Alison Kilpatrick, the Chief Commissioner of the Northern Ireland Human Rights Commission, for her engagement and contributions to the bill, and I want to briefly address some of her raised points. So the Chief Commissioner welcomed the bill's proposal for increased engagement with bodies with an interest in autism. However, she suggested the autism strategy should expressly compel the department to involve and consult autistic people, their families and carers. I wholeheartedly support increased co-production and have welcomed the department's creation of an autism forum, which includes autistic adults with lived experience. However, I am currently beginning discussions with the Bill's Office as to areas that we may want to look at in terms of amending to strengthen the bill, and we'll discuss this possibility. I fully agree with the Chief Commissioner's emphasis that autism is not just simply a health matter. We need to look at all of the needs of autistic individuals and ensure effective cross-departmental coordination in assessing and addressing need. Although the Department of Health is the lead department in this bill, it is important to recognise that this is a cross-departmental piece of legislation, and we need to ensure other departments are stepping up to the mark in relation to their duties on autism. I appreciate the Chief Commissioner has recognised part of the proposed function of the annual autism reports is to ensure other departments meet their duties in fulfilling the autism strategy. The Commissioner has welcomed the proposal of training initiatives to Northern Ireland departments and bodies, suggesting such training improves public awareness and understanding of autism, and I would argue could improve the everyday experience of autistic individuals. So I do appreciate Alison's general support of and interest in further engagement in the development of the autism reviewer role. I wanted to move on to thank Sherelle Stewart for representing the National Autistic Society, which I'm going to refer to as NAS from now on, for her contributions. Sherelle has a wealth of experience in the area of autism, so I really want to thank her for her helpful contributions to the discussion. And again, I want to briefly address some of the points raised by NAS. So NAS has welcomed the inclusion and focus of the needs of autistic adults, stating previous strategies have failed to meet their needs. They did, however, offer some suggestions as to further areas which need to be considered. I agree with their suggestions that mental health needs and independent living skills need to be considered when setting out how the needs of adults will be addressed within the strategy. However, I believe these areas would be addressed under the current areas set out in the bill around emotional and mental well-being, supported living and lifelong learning. NAS asked clarity on the stipulation that the autism strategy must take a multidisciplinary approach. This stipulation intends to ensure input into the strategy comes from a range of health and social care professionals from different fields, to ensure the strategy draws appropriately from multiple disciplines to consider a range of perspectives to assess, plan and manage in a more holistic way. NAS also raised the issue of co-production, and they have suggested the bill should provide clarity on how the autism reviewer is to engage with the autism forum and in setting targets for the autism strategy. So when drafting the bill, we were concerned with ensuring all those with an interest in autism would have the opportunity to contribute to engage with the planning and implementation of the autism strategy, which is why we were careful to include the phrase without limiting the generality of consultations required under Section 2 when stipulating bodies with an interest in autism who should be consulted on the strategy. So I welcome the work of the Autism Forum and agree that it would be most beneficial for the Autism Forum to work with the Autism Reviewer and the department. However, I believe that the Autism Forum would be considered a body with interest in promoting the rights of persons with autism and should be consulted. The National Autistic Society have also echoed a concern I have heard raised on a number of occasions, which is how best to ensure the Autism Reviewer role is an effective scrutiny mechanism. And NAS have argued the reviewer must be independent of the department to ensure credibility and avoid a conflict of interest. The reviewer must have the ability to work with the Department of Health and other departments. What is meant by independence and what that will look like is very important. As I've previously mentioned, I am open to looking at suggestions and possible amendments that will strengthen and improve this bill, and I intend to have a more in-depth discussion with the Bill's Office on how this could be achieved in coming days. NAS highlighted worse waiting lists for adults as sufficient money was not put into adult assessment and diagnosis, and noted large disparity in the services for children and adults. So this is not acceptable. This is another area where I believe the Autism Reviewer is essential for improvement. Part of the proposed functions of the reviewer are to review autism funding arrangements, the law and practice relating to autism, and to review the adequacy and effectiveness of services. I want to finally thank all the representatives from the different health and social care trusts and the department for their engagement and constructive contributions. The trust evidence also highlighted adult services were significantly, severely challenged, in need of significant investment in services and measurable targets to judge efficacy, and that the current services in place for assessment and diagnosis of children are inadequate to meet the current need. So this is not new information for us, and this supports the rationale for collecting adult data to inform service provision. However, there should not be focused on adult or child services, but timely access to assessment and intervention for all autistic individuals. I welcome the reports from different trusts that there are aspects of the data collection that could easily be improved without too much added resource, and I believe all of the trusts stated they had the capacity to collect data on private diagnosis and integrate this into their current data collection without much difficulty. I am one of the many concerned with disparity in autism rates across Northern Ireland, and it's essential we begin to improve how we collect and use data to inform and improve services. The trusts and departments confirmed the absence of consistent recurring funding is a barrier to effective service planning, and I believe the functions of the Autism Reviewer, combined with the duty on the Minister to lay an annual autism funding report before the Assembly, could help address this. It has been evident, Chair, throughout the process that there is a real genuine need for approved autism legislation and a genuine desire for change within our services and systems to improve the lives of autistic people, their families and carers. I'm incredibly grateful for the support I've received so far for this bill and appreciate the constructive engagement I've had with different individuals, bodies and organisations. So I'm going to leave it there, Chair, and at this point, if there are any questions, we will be happy to answer them.
Okay, thank you, Pam. And we have now been joined by Arlene online, so I'll just double check your sound. Arlene, can you hear us okay? Okay, so you're hearing us, Arlene. We're not hearing you there, so if you can just check if there's anything on your end of things. But I'll go ahead then back to members' questions, and hopefully we'll be able to pick up from Arlene in due course. Okay, Pam, thank you. And I want to say at the outset, I do think this is an area of huge concern out there. I know we've raised it in the Assembly. I know that the All-Party Group have been actively raising, and indeed many organisations and individuals over a long period of time have been highlighting the difficulties that lack of services, lack of diagnosis, lack of support is having for the people who are having to live with and deal with this situation on a daily basis. In relation to the evidence session, you have touched on some of this, Pam, and I suppose I'm just seeking to maybe draw out a little more detail, but in relation to the reviewer, and you have said that you're looking at potentially maybe amendments in terms of the independence, can you give us any indication as to what where you're leaning in terms of how that might be strengthened to ensure we have rigour and independence in any reviewer appointment?
Thanks, Chair. Well, just to say that because we've had so little time from last week, we haven't had the opportunity to have those meetings with the Bills Office, but we are setting those up now because we don't want to kind of throw stuff out there that's not accurate or appropriate. So, I mean, it's something that we've been concerned about from the very beginning and very cognizant of the need to ensure that independence in that role. So it's just really us trying to work out how best to achieve that, and that's why we're interested to hear from everyone else as to what their views and how that would work best. But it is really vital that independence is there, and it's just working out how best to slot that role in and where that role would sit. I think it's still up for some debate. I don't know if maybe Arlene or Kerry want to add into their view as to where that role would sit best, but certainly around the wording, we are dependent on meeting with the Bills Office to further consider any wording around an amendment, but I think we absolutely do need to amend it to strengthen that independence part.
Thank you. And Kerry or Kelly or Arlene, does anyone want to contribute to that?
Arlene, can you hear or can you speak there? I can't see.
I know, I think it's frozen. Can you hear me?
Yes, we can hear you. Do you want to speak on this or do you want?
No, you go ahead. I'm having technical difficulties here because I think I'm frozen on the screen, but you can hear me this time.
We can hear you okay, so we can. Basically, the number one priority would be that it is independent from the Department of Health, because we've been waiting for the past. The original Autism Act was brought in 10 years ago. We're now in 2021. It was brought in 2011, and we know that it has basically failed the autism strategy whenever it's been sitting within the Department of Health, and therefore we feel that anybody that should be scrutinising it should be independent from that department. Whether it sits within the executive office, I don't know if that's possible, but definitely from our point of view, we feel that it definitely needs to be independent from the Department of Health. And it needs to be somebody who has obviously knowledge of government policy and how to implement strategies in that as well. But I feel it shouldn't be within the Department of Health. I don't know what you think about this, Pam.
Well, could I maybe join in? Oh, here.
Yeah, go ahead, Arlene. Yeah.
We can hear you, Arlene. Go ahead.
All right. Well, okay. Well, it's maybe a blessing you can't see me, so. Right. It was really just to reinforce what Kerry has said, really, that the Department of Health have appointed a number of coordinators, autism lead. They have tried various strategies, and we are where we are in terms of the lack of implementation of the Autism Act, the original Autism Act. I think there was a very good point made by Sherelle Stewart, National Autistic Society, last at our evidence session, when she said that she reinforced the need for the person to be independent of the Department of Health to restore credibility in the process, to restore credibility in the Northern Ireland autism strategy. The failure has been so profound that something dynamic needs to be done to get us out of this logjam. And the Department of Health have employed a number of people internally, and still we are where we are. And really, it's just really to reinforce everything else that Kerry has said. Thank you.
Thank you. Yeah, and in relation to the structure of the reviewer, and I know the issue has been raised in the committee in relation to scrutiny on the bill, and I suppose this touches upon the cross-departmental nature and the fact that there are implications here for education and for other departments. What's your thoughts on this stage, having heard evidence, and I know there's different views on it, but what's your thoughts at this stage in terms of a panel approach to the reviewer to bring in a wider range of expertise?
Kerry, do you want to comment on that?
I think this was brought up before in a previous committee session we had. I don't feel that a panel would work. I feel, again, that you're diluting it. I think it needs to be one person taking the reins on this. I think we've had enough time to try and get it right, and we haven't got it right. And I feel that a panel approach would be sharing the responsibility amongst a number of people, whereas I think if you had one single reviewer whose job was solely to ensure the strategy is done once and for all and ensure that everyone gets the right support, that's what I feel the way it should go.
Could I add to that, please?
Yeah, go ahead, Arlene.
Chair.
Yeah, go ahead.
I think it's it would introduce an element of duplication that would be unhelpful and not really cost effective as well. There are a number of bodies, as has been referred to earlier, a number of stakeholders who are already involved who can be consulted. I think there's no doubt that the autism reviewer would need support because there's an operational side to this and there's a research side to this. So, within that, there needs to be, within that dynamic of the autism reviewer office, I think those are the key dynamics that are required to move this forward. And yeah, I think that my thought about, I think really that's it in essence. I think if we introduce a panel approach, we are introducing duplication. There are structures out there already that need to be utilised more effectively and coordinated and driven forward, and that's what the autism reviewer is there for. Thank you, Chair.
Okay, and then in general, and you have touched upon some of the suggestions made by the Autistic Society of Shirrell in relation to some of the other areas, and you have indicated, Pam, that you are talking to the Bills office. Can you give us any indication as to what broadly areas may be of benefit in terms of strengthening the bill, in terms of amending?
I think, Chair, primarily the independence, strengthening that assurance that the review role must be independent. I think that's primarily the most important amendment that we're seeing coming through at this point. I think, we have really good legislation already there, as Kerry has touched upon. It's 10 years old. We already have good legislation there. This is about making it work at this point. This is about, and that's why I suppose the panel issue is probably not a way that we think that we should be going, because we have good legislation there. It's about how do we implement this, how do we make it work, and make it work across departments. How can we ensure that independence of that review role to ensure that we get the best outcomes from this really good legislation?
Okay, thank you. So I'll go to other members then. So I'm going firstly to Deborah, and then I have Carol. So go ahead, Deborah, please.
Thank you, and I want to thank Kerry, Kelly and Arlene today, and also want to thank my party colleague Pam Cameron, who's bringing forward this bill, which is such an important piece of legislation. We all know that there are many families struggling and would really benefit from extra support that we may see coming out of this bill. So really my question is quite simple really in what I'm going to ask, but the evidence from the University of Ulster professors, from NAS, the Trust and the department outlined that current services are not sufficient to cope with the current demand for autism assessment and intervention. And we know of the huge backlogs of waiting lists and autism waiting for autism assessment. So how would this bill, if implemented, bring about the practical changes to these circumstances?
Thank you, Deborah, and thanks for your kind comments. And I just want to reiterate, as the chair did at the beginning, that I am the current chair of the all-party group on autism, and this really is where this private member's bill has originated from. This is not my bill on my own. This is me heading up something in support of the all-party group, and I'm very grateful to all the parties for their continued support on the issue. I think we all recognise the need for this bill. So, Deborah, in answer to your question, the Autism Reviewer is intended as a scrutiny mechanism able to review the department and trust practice. So part of the reviewer's role will be to ensure the law and practice in Northern Ireland and services relating to autism is fit to meet the need. So the Regional Information Service and the Early Intervention Service are intended to provide individuals with the support as soon as they need that support and as soon as that need is identified. So the idea is that individuals across NI will be signposted to advice, support and receive appropriate intervention as soon as possible. So the bill strengthens the data collection, the provisions of the autism strategy, and outlines the needs of autistic adults must be met in the core areas.
Thank you.
Okay, thank you. Anything else, Deborah, or was someone else wanting to contribute to that answer?
Really, Chair Arlene here.
Yeah,
Deborah, it was really just to say that the element that came out of the evidence from the Health and Social Care Trust, one of them was the failure of the existing Northern Ireland autism strategy in addressing the cross-departmental sort of imperative within the original Autism Act. So that, again, is another relatively fertile area for development. So I think that out of the words of the trusts, I think that reinforces our own feeling, and that would be within the remit of the Autism Reviewer as well. to look at the cross-departmental dynamic and therefore, knock-on effect to the possibility of joint planning, joint funding of projects and services, because that has not really been driven either. Thank you, Chair. Thanks, Deborah.
Thank you.
Okay, thank you, Deborah. And going to Carol then. Go ahead, Carol, please.
Thank you very much again for coming in front of the Health Committee. I mean, I suppose some of the concern when the legislation was introduced all those years ago that I had was that it did go to the Department of Health, just very much for the points that you have raised continually. It may have been better going to FM then to ensure that the cross-departmental nature was adhered to. But one of the issues was that one of the trusts also mentioned concerns that the reviewer should be independent of the third sector. Maybe that's not what they said, but that's certainly what was hinted at. One of the issues I have is that unless you have, so we all agree we need independence, but unless it's rather than one person, you bring other skills and expertise in, then you're very much relying on that one person. So how can that be achieved? And the other aspect is, I'm aware that it's down to a department to ensure co-production and co-design, but what role? How would that happen within a one-person reviewer as well? Because that's key. And where do the role for people with autism have in that also?
Thank you, Carol, for your questions there. I think we are getting into complexities now of this bill, but I suppose just to reinstate, this is not about reinventing the wheel. And here's my dogs featuring now. I knew they wouldn't be too far away. This is about making already good legislation work and actually bringing it to the fore and seeing the outcomes of that legislation. It's about strengthening what's already there and making it work. And I suppose there maybe are more conversations around that role of the reviewer and how best that could work. But I suppose in my head, I see very much the mental health champion as a good example of how a single role can be very effective, I think, and especially if that role has been embraced by all the departments. And I think that's what's happened there. So that is probably a good example of how everybody needs to be bought in to the same subject. So we obviously have a lot more work to do on this to tidy up where we are with that and to really define how best that reviewer role could work. But what we don't want is extra layers of complication. We want to drive through the changes that need to be made so that autistic individuals actually get what they need on the ground and that they get that at as early a point as possible.
Yeah, please.
I do think the reviewer, as I've said all along, needs to be one person have a responsibility for it. But like every organisation and every committee anywhere has somebody who leads on it, and that's what I feel that this reviewer should be, the person that has responsibility to lead on this and be independent, but also they need to work obviously with the autism community, autistic adults, the voluntary sector and the departments in that to find out exactly what is going on. They need to get the full picture, so obviously they'll be doing that as well in the background. However, as Pam said, if you have a panel, there's been panels and forums and all done before, Carol, over the past number of years. We need one person who has the right experience and understanding to be able to drive this forward and to have that overview of what is going on, but also work with other organisations and other people and obviously the autism community to make sure that what we're doing as what you guys are doing as a government is what is needed for the autism community. But I seriously think it needs to be one person taking on this role who has that experience and can do it and can drive it through. we can't wait any longer. Basically, we have done all this before, had forums, we've had meetings, we've had panels with everyone has different views. This is our chance now to get it right and have that person that has the passion to drive this forward.
Okay, Carol, anything further? No. Okay, so I'm going then to Paula Bradshaw. Paula, go ahead, please.
Thank you, Chair. Thank you, panel, for the update today. It's been very helpful. I really don't have a question. It was more just a positive response to Pam's commitment there to look at the amendments that Sherelle Stewart has brought forward. I thought her paper was excellent and some really, really robust but tangible suggestions to embolden your bill. So it's just really to put that on record and to thank all the ladies on the call today for their hard work in this subject matter. Thank you.
Okay.
Thank you, Paula. Thank you. And I agree with you. And I think Sherelle, as I said in my remarks, has a wealth of experience. And this is exactly the type of people that we need to be listening to ensure that we make the improvements that are required. Thank you for your comments.
Okay, so members, I think that is really all the indications I have in front of me there from members at this point in time. So I would like to thank you all very much for contributing to the evidence session here this morning, and indeed we've passed into the afternoon. So Pam, in relation to bringing forward the bill, Kerry, Kelly and Arlene, that's all there is by way of questions at this point in time, and we can continue on with our consideration of the bill, but thank you for your attendance here today. Thank you very much.
Thank you.
Thank you.
Thank you. Okay, members, thank you for that. So members, we will be having informal deliberations on this bill at next week's meeting, and the committee will then consider if it wishes to bring forward amendments to the bill. So any other comment or issues that members want to raise at this stage, or members wish to bring to next week's meeting? Okay, thank you, members. Then that concludes that session. So moving on to the Hospital Parking Charges Bill, item 8, and this is in relation to the handling arrangements that we need to agree in terms of how we handle the arrangements around the Hospital Parking Charges Bill. The bill passed second stage on Monday 22nd of November and is now in committee stage. The committee therefore must now consider how we will approach our scrutiny of the bill. So do members wish to declare any interest? No, thank you. I refer members to the papers at tab 8 of the pack, particularly to the clerk's memo at tab 8.1, which outlines the decisions that the committee must make in relation to the bill today. Included in your table papers at tab 8.4 is a raised paper, a research paper on the bill, and I would ask the clerk to take us through the committee stage process, please. Thank you, Clerk.
Thanks, Chair. Members will be all too aware of the process for committee stage now, but essentially with this bill coming across to us, we undertake a call for evidence. So given the time constraints on this bill, I'm suggesting that really the longest we can put it out for a call for evidence is probably 3 weeks. So if we were to get it out, hopefully within at the start of next week, we could let it run until the 22nd of December, which would give time for individuals and organisations to send in submissions. We'd also send written invitations to Department of Health, the trusts, staff unions and representative bodies. And if there's any other organisations or bodies that members would want us to write to invite written submissions, I'd be happy to receive them by email, and we can make sure we get the invite out to them. So we will aim to get the call for evidence out early next week. So that'll go in the local newspapers, it'll go on the committee's webpage, and that will be the call for evidence. I suppose the more difficult thing is in relation to the timing of this. We obviously have 4 other bills going through at the minute, and really if we're looking to start taking evidence in this, we're probably going to have to start taking evidence in early January, which means probably if we're looking to complete scrutiny of this bill, certainly from my recommendation is that we probably need to extend to the end of February. on this bill, with the hope of maybe bringing it in sooner, depending on what issues come up or what amendments there are. So I suppose they're the two main issues: getting agreed for the call for evidence for 3 weeks, consideration of an extension, and then also agreement from members that we just publish all the written submissions as they come into us, and we'll get them all online for everyone to see as well. So, Chair, that's the...
Yep. Okay. Thank you. Okay, members. So, in light of that, then, in terms of the extension of committee stage, just let me take off Mr. Leaf. Just a minute. Oh, go ahead. Go ahead, Carol. Okay, go ahead.
So sorry. So it says part of the evidence. Can we, because I should refer to it as part of the debate in the chamber on Monday, can we suggest just getting some evidence from Wales and Scotland as well, just given the fact that they've abolished car parking charges in public hospitals, please?
Yep, members content with that. Yep, clerk. Okay. Okay. Thank you, Carol. In terms of the extension of committee stage, then, as outlined by the clerk, a draft to the end of February, a draft motion will be formally agreed at next week's meeting. Then, members. Okay. Thank you. And then, can we agree to refer the bill to the Examiner of Statutory Rules for delegated powers advice? Members content with that? Yep. Thank you. In terms of the call for evidence, the committee we're asked to agree that a call for evidence on the bill is issued on the 29th of November with the closing date of 22nd of December. Are members content? Yep, thank you. We also, committee, are asked to agree to invite the views of the Department of Health, the Health and Social Care Trusts, staff unions and representative bodies on the bill, and that has been added to by taking a hearing from Scotland and Wales who have experience of a similar scheme. Yep. Are members agreed with that? Yep. And then, can we also agree that papers will be published on the committee webpage? These include extracts of meeting minutes, links to Hansard, research papers, written submissions and correspondence. Are members content with all of that? Yep, members content, thank you. Okay, members, thank you for that. So moving on then to item 9, which is SR 2021/293, the Health Protection Coronavirus International Travel 2021 Consolidation, Amendment Number 8 Regulations NI 2021. I refer members to the papers at tab 9 of your pack. Members will recall that the committee was briefed by department officials at last week's meeting, and we agreed to defer formal consideration of the regulations until this week. The committee asked the department for further information on the use of LFD tests and checks on the compliance of post-arrival travellers required to self-isolate. The department's response is included at tab 9.4 of your table pack, members. The response advises that following issues raised by us last week, the Department are proposing to provide clarity in relation to the definition of LFD tests and in a further set of regulations, and that guidance on NI Direct will be updated to clarify where the tests can be taken. So I do welcome that clarification. I think that does. I think there's a recognition inherent within that there was those issues were in need of being addressed. So and I think that they are clearly indicating that those are or will be addressed. So we do have officials on standby if anyone has any further questions they wish to ask in relation to this item. And if not, then we'll move on to formal consideration. Okay. So members, we're now then moving to formally consider the SR. I can advise that the Examiner of Statutory Rules has reported on the SR and confirms that it was in breach of the 21-day rule, although the Examiner is content with the Department's explanation for the breach. The Examiner has also identified an issue in relation to a missing schedule number and that it should read Schedule 6, and the Department has corrected this through a correction slip. So do members have any further issues they wish to raise in relation to this statutory rule? No. Can I therefore ask members to agree formally that the Committee for Health has considered SR 2021/293, the Health Protection Coronavirus International Travel 2021 Consolidation, Amendment Number 8 Regulations NI 2021, and has no objection to the rule? Are we agreed? Agreed. Thank you, members. Okay, members, the next 3 agenda items then are regulations relating to smoking and tobacco products. Members will recall that the committee was briefed by the Department on these regulations on the 7th of October. The committee asked the Department if it has given consideration to the inclusion of electronic cigarettes and vaping in the smoke-free vehicle legislation, and that if this is not possible, what consideration the Department has given to bringing forward similar legislation. The Department did respond that it would be difficult to legislate against vaping in cars in the absence of evidence of harm, but that it would continue to monitor emerging evidence and consider appropriate legislative action if that were to be required in the future. That response is contained at tab 10.4 of your pack. The committee will now consider each of the SRs in turn, and I refer members to the papers at tabs 10 to 12 of the pack. All 3 SRs are subject to draft affirmative resolution, and the examiner does not raise any issues in relation to these SRs. So moving then to item 10, which is the smoke-free private vehicles regulations NI 2021. This statutory rule will extend the existing smoke-free legislation by setting out the circumstances when private vehicles are smoke-free, i.e. when they are enclosed, there's more than one person present, and one of those present is under the age of 18. It will allow the use of fixed penalty notices for offences in relation to smoke-free private vehicles, and it will designate both the PSNI and district councils as enforcement authorities for all smoke-free vehicles. So have members any further issues they wish to raise in connection with this statutory rule? Paula?
Thank you, Chair. I must have missed this at the time, and it's in relation to Regulation 2.2, and it's the exclusion of motorhomes because they're deemed to be living accommodation. And I'm just wondering what happens in the event that it's actually travelling. I'm talking about the sort of motorhomes as opposed to caravans.
Okay, and I'll just check with Clerk how we might address that query at this stage.
At this stage, we can certainly write to the department to seek clarification on it, but we will need to consider the SRs. This is.
Yeah. So are you content that we raise that issue, Paula, but go ahead with the SR to allow the regulations to continue, but that we raise it with the department?
Yeah, I certainly don't want to do anything that would delay these coming into force, and apologies that I didn't pick up on that particular issue earlier, but a letter to the Minister would be sufficient at this stage. Thank you.
Okay, thank you. So then, any other issues arising? No, thank you then. I'll ask members. Yes, who's indicating there? Pam, go ahead, Pam.
Sorry, I'm just trying to get in there too. Just if you're writing to the Minister anyway with Paula's query, which is a really good one, it was just to check as well about, what happens, how does this apply if someone's already smoking and someone else enters the vehicle, and how do the regulations apply in the situation where there are 2 adults present in the vehicle and both are smoking? So that's just to add to that query if you're sending it through to the Minister, but I too wouldn't want to be holding back on this as well because we generally are very supportive of it.
Okay, yeah, I think those can be raised. I think if memory serves me right, there was reference that the driver would be responsible in that. I'm not sure if that covers your query or not, Pam, but certainly I think we can put those queries in, and those can then be factored into any reviews or any additional work that's being done in relation to this area. But like committee members, I think it is generally a very welcome and a very good step that this is being brought into line. It's also long overdue as well, so I do think there is a kind of an imperative on ensuring that it goes through and that all those issues are picked up on for consideration as well. Okay, so members, then I'll ask members to agree formally that the Committee for Health has considered the smoke-free private vehicles regulations NI 2021 and recommends that it be approved by the Assembly. Are we agreed? Agreed. Thank you, members. Moving on then to item 11, which is the nicotine inhaling products, age of sale and proxy purchasing regulations NI 2021. This SR makes it an offence to sell nicotine inhaling products to persons aged under 18 and for an adult to purchase nicotine inhaling products on behalf of a person aged under 18. So have members any further issues they wish to raise in relation to or connection to this statutory rule? No, thank you. Pam, go ahead, your hand raised there.
It was just really, again, to check with the department to see how, what communications plan will be in place, or an awareness campaign around all of these issues. I think it is really important, and we do welcome we've got this far because we're obviously playing catch up with the rest of the UK, and it has been too long, and there's been a very big delay in this legislation. So we do welcome it. But I would just like to know what type of communications plan is going to be in place.
Okay, yep, thank you. Yep, we can certainly do that, Pam. And any other issues members wish to raise? No, thank you. Okay then, so members then, I'd ask you to agree formally that the Committee for Health has considered the nicotine inhaling products age of sale and proxy purchasing regulations NI 2021 and recommends that it be approved by the Assembly. Are we content? Yep, thank you, members. And just to flag as well, members, that all of these, any of these points or all of these points can be raised also in terms of the debate that will be taking place on this, so that will be another opportunity to flag those issues. In relation to item 12, the tobacco retailer fixed penalty amendment regulations NI 2021. This SR is part of the enforcement regime for the previous SR and allows for the inclusion of amounts of fixed penalties for offences relating to the sale or proxy purchase of nicotine-containing products. Have members any further issues they wish to raise in connection with this statutory rule? No. If not, then can I ask members to agree formally that the Committee for Health has considered the tobacco retailer fixed penalty amount amendment regulations NI 2021 and recommends that it be approved by the Assembly? Are we agreed? Yep, members are agreed. Okay, members. The next item we're moving into is SL1 Coronavirus Extension of Powers Act. However, I had indicated that we would take a break around 12:30, and I don't want to maybe break in the middle of a particular session. So I'll propose that we take a 20-minute break at this point in time, and we return to this item at 12:45. Thank you, members.
I'm signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly.
Okay, thank you, members. So we're now back in session and resuming at item 13, which is SL1, Coronavirus Act, Extension of Powers to Act for the Protection of Public Health, NI Order 2021. So the Department advises members that it intends to make this order to extend Section 48 and Schedule 18 of the Coronavirus Act and use the emergency powers to make regulations to control the spread of coronavirus if needed. A departmental official is here today to brief the committee on the provisions of the proposed order. So I'd now like to welcome by Starleaf Mr Richard Duffin, who works within the Health Protection Branch 3 Coronavirus Restrictions. Richard, can you hear us there okay?
Yes, Chair, I can hear you. Can you hear me?
Yep, we're hearing you there fine, Richard, at this point. So, Richard, I'll go ahead and invite you, please, to brief the meeting in relation to this SR. Thank you.
Thank you. I'd like to thank the committee for your invitation today. If you're content, I'll brief the committee and summarise the proposed order. The Coronavirus Act, Extension of Powers, the Act for the Protection of Public Health, Northern Ireland Order 2021, purpose is to extend the expiry date of Section 48 of the Coronavirus Act 2020 and the provisions in Schedule 18, currently due to end on the 24th of March 2022, up to and then extend them to the 24th of September 2022. Section 48, along with Schedule 18, inserts powers into the Public Health Act Northern Ireland 1967 to make health protection regulations for the purpose of protecting against, controlling or providing a public health response to the incidence or spread of infection or contamination regarding coronavirus in Northern Ireland. The primary public health legislation in Northern Ireland is the Public Health Act. The Act does not provide regulation powers to respond to COVID equivalent to those in England, Wales or similar legislation in Scotland. The powers inserted by the Coronavirus Act enable the Department to make regulations which are consistent with those provisions that may be made in the rest of the UK under their equivalent powers. The temporary provisions made by the Coronavirus Act have been used extensively in the making and amending of general restrictions and international travel restriction regulations over the past year. Around 45 sets of restriction regulations have been made to date, along with approximately 40 sets of international travel regulations. During the course of the pandemic, the infection rate has changed rapidly over time, and the regulation powers introduced by Section 48 have enabled the Department of Health to act quickly to introduce legislation to support efforts to prevent or control the spread of the coronavirus infection. The situation continues to evolve, and the Department wishes to be able to continue to respond effectively and flexibly to meet the need to protect public health. The Coronavirus Act is due to expire 2 years after its commencement, unless Parliament decides to extend it. When the Coronavirus Act ceases to have effect, all of the secondary legislation made to date under the temporary modifications made to the Public Act by Section 48 will also cease to have effect on that date. Unlike other UK jurisdictions, Northern Ireland will revert to a position of not having public health regulation making powers specific to coronavirus and consistent with those in other jurisdictions. unless and until primary legislation including such provisions could be brought before the Assembly. For that reason, and as the virus remains in circulation, and it is difficult to predict its trajectory or how long it could remain in circulation, the Department would intend to retain the powers in Schedule 18 to make regulations should they be required after 24th of March 2022, in the absence of any other suitable powers. It is proposed to use the powers in Section 90 of the Coronavirus Act to extend the operation of Section 48 for 6 months by the means of this order. If the committee is content, at this stage, I can either take some questions, or if the committee is content, I can walk through the provisions in Schedule 18.
I think we'll walk through the provisions first, Richard, and then we'll go with questions and questions in the block. Then, please, thank you. Okay.
Schedule 18 inserts various provisions as Part 1 into the Public Health Act 1967. And the committee should note that references to sections here are also the sections in Part 1 of that Act. Section 25A, which is infection or contamination, defines certain terms used in this part. It provides that the reference to infection is to that which presents or could present significant harm to human health. It also provides that reference to disinfection or decontamination includes the removal of any vector, agent, or source of infection. Section 25B, the Health Protection Regulations International Travel, enables the Department to make regulations for preventing danger to public health from conveyances or the persons or the articles on those conveyances arriving at any place, or preventing the spread of infection by conveyances leaving any place. It also provides a power for regulation to give effect to the international agreements or arrangements, for example, the World Health Organization recommendations. Section 25C, Health Protection Regulations Domestic, provides a power for the Department of Health to make regulations to prevent, protect against, control or provide a public health response to the incidence or spread of infection in Northern Ireland. The threat can come from outside Northern Ireland. The section gives examples of particular provisions which may be made, for example, to set out the requirements for notification of cases of specified diseases by registered medical practitioners to the Public Health Agency, to impose restrictions or requirements directly on persons or in relation to things or premises, or to enable another body, such as a district council, to do so. It also provides examples of restrictions or requirements that might be imposed and includes a list of things that are special restrictions or requirements. Some measures, however, are not regarded as special restrictions or requirements, such as a requirement to keep a child away from school, a restriction on the holding of an event or gathering, or a restriction or requirement relating to the handling, transport, burial, cremation of dead bodies, or the handling, transport, or disposal of human remains. Section 25D, restrictions on the power to make regulations under Section 25. This contains the restrictions on the exercise of the powers under 25C. The section prohibits the Department from making regulations containing restrictions or requirements under 25C, number 3C, unless the Department considers when making the regulations that the measures are proportionate to what has been sought to be achieved. Similarly, under Section 25D, regulations which enable imposition of restrictions or requirements under 25C, 3C, must provide that the person who decides to impose such a measure can only do so if the person considers when taking the decision that the restriction or requirement is proportionate to what is sought to be achieved by imposing it. It prohibits regulations from directly imposing a special restriction or a requirement requiring medical examination, removal to or detention in hospital or other suitable establishment, or isolation or quarantine. Regulations may only enable the imposition of a special restriction or requirement by a decision maker if either of the conditions in the section 25D4 are met. These conditions are there that the conditions are that there is a serious and imminent threat to public health when the regulations are made, or the imposing of the restrictions or the requirements is expressed in the regulations to be contingent on there being such a threat at that time that the decision to impose them was made. Section 25E excludes compulsory medical treatment, including vaccination, from the ambit of the regulation making powers in sections 25B or 25C. Section 25F are health protection regulations supplementary. We make further provision about regulations under section 25B or 25C. This includes details of when the regulation may be used to amend primary or secondary legislation. The section outlines the penalties for the offences that can be created using the regulations. It makes provision about reviews and appeals in relation to special restrictions or requirements imposed by virtue of a decision taken under the regulation made under section 25C. Where a special restriction or requirement is imposed on or in relation to a person, thing or premises, the regulations must include provision for an individual or business to have a right of appeal to a court of the summary jurisdiction against the decision. The regulations also make available a right of review at specified intervals to specified persons for special restrictions or requirements which continue in force in relation to any person, thing or premises for more than a specified period. The next few sections 25G to 25O, outline the provisions related to court orders made by a magistrate's court. 25G is a power to order health measures in relation to persons. It sets out the criteria that must be met for a district judge to make an order under that legislation in relation to a person. The judge must be satisfied that the person is or may be infected, that the infection presents or could present significant harm to human health. There is a risk that the person may infect others, and it is necessary to make the order to remove or reduce that risk. The section describes the measures that the order can provide for, including such things as submit to a medical examination, be removed or detained in a hospital or other suitable establishment, kept in quarantine or isolated, be disinfected, wear protective clothing, provide information, have their health monitored, attend training or advice sessions, or be restricted as to where they go or with whom they have contact or working or trading. There's also powers to order health measures in relation to things and in relation to premises. These fall under sections 25H and 25I. They enable a district judge to make an order if conditions similar to those in sections 25G are satisfied, but in relation to things and premises respectively. An order in relation to a thing might require, under section 25H1, that that thing be seized or retained, kept in isolation or quarantine or disinfectant. It may also require, in the case of a dead body, that that body be buried, cremated, or in any other case, that that thing be destroyed or disposed of. Similar measures are available under section 25I in relation to premises. 25J deals with provisions of court orders in respect of groups, things, or premises. This will assist a district judge to make the same provision in one order where, for example, more than one person is or may be infected. 25K makes supplementary provision about what can be included in an order of a district judge. It includes at section 25K3 a provision that a measure in an order may be conditional. For example, an order may state that if an individual refuses to comply with the requirement as the judge considers necessary, he must stay in isolation until the risk of infecting others has passed. Section 25K5 allows the judge to include in an order directions as to the actions that might be appropriate to give effect to the order. This might, for example, include putting in place support provisions for a person undergoing a measure such as quarantine. 25L outlines the period for which Part 1A orders may be enforced. It makes provision with regard to the length of time for which any restriction or requirement imposed by or under an order made in force. The section requires any restriction or requirement in an order to have a specified time limit. Further orders can be made extending the period for which the restriction or requirement is imposed beyond that time limit. Section 25M sets out the procedures for applying, making or changing or revoking a magistrate's order. Only the Public Health Agency may apply for an order, but an affected person, that would be, for example, a partner or a premises owner, in addition to the public agency or any other authority with function or of executing or enforcing the order in question, can apply for the order to be varied or revoked. Section 25N has powers to make further provisions by regulation. It enables the Department to make regulations dealing with matters relating to the taking of measures pursuant to orders, including the provision described in this section. Section 25O is enforcement of Part 1 orders, provides that it is an offence to fail to comply without a reasonable excuse with a restriction or requirement imposed by or under an order of a district judge in a magistrate's court, or to willfully obstruct anyone executing that order. The offence is punishable by a fine not exceeding level 5 on the standard scale, and a remedial action order can also be made. Section 25P now looks at the Assembly control. It sets out the different Assembly procedures for making regulations under this part. In general, regulations, including those under Section 25B, are made under the negative resolution procedure. Regulations made under Section 25C are subject to the draft affirmative resolution procedure unless they contain a declaration under Section 25B(5) that the regulations do not contain any provision made by virtue of Section 25(3)(c) imposing a special restriction or requirement or other restrictions or requirements that would have a significant effect on the person's right. Section 25Q outlines the emergency procedure. Regulations of a kind to which draft affirmative procedure would normally apply may be made and brought into effect immediately under Section 25Q if they contain a declaration that the Department is of the opinion that it is necessary by reason of urgency for them to be made without a draft being approved under that procedure. After regulations are made in accordance with this procedure, they must be laid before the Assembly. If the Assembly decides to reject the regulations, then they will cease to have effect at the end of the day on which they are rejected. They will also cease to have an effect after 28 days if a resolution approving them has not been passed by the Assembly.
Richard, sorry, just in the interest of time, Richard, I'll maybe move to members' questions, and then if members wish to pick up on the detail of any of the subsequent ones to where you've arrived at that, I think we'll move back to question and answer session. So thank you for that. I suppose in the first instance, I want to, from my own point of view, it's very clear we're still in the midst of a very, very serious public health crisis. Now, I know that certainly we would not have, and I don't believe anyone would want to have put through legislation of this type on an emergency basis, and that certainly is something that we wouldn't do in normal times, but we haven't been, nor we are not yet in normal times, and I think that's a hugely important issue to note. It's also relevant to note that COVID-19 and coronavirus continues to circulate right across the globe, and indeed across the continent of Europe. It's probably in many ways even worse than the situation that we're dealing with currently here on the island of Ireland and between here and Britain. So I think that speaks to the necessity of the legislation, and I think while it's regrettable that we're still in this situation and now looking at moving these forward, I think that's the context in which we have to move forward. I do welcome the opportunity for the committee to consult and to contribute to the regulations and to consider them, and I think there have been some useful examples where that has added benefit to the regulations, and I think that should continue to be done, but also that the department should continue to consider how that process can be better facilitated in terms of time and in terms of how soon and the process by which the regs are being brought forward to committee and to the Assembly for consideration. So I think that's useful. In terms of enabling other bodies to carry out some of the enforcement that you'd mentioned earlier, I'm conscious that the committee did take a decision and did provide that ability, but we haven't seen a huge amount of that being done, and an awful lot of the enforcement seems to have fallen to police enforcement. So I just wonder myself whether there is a potential now to review who else can assist in terms of dealing with the outworkings of COVID and with the restrictions. And in particular, I think it's important, and this has been a continual theme of the committee, it's important that we find a way to monitor the impact of individual either restrictions or lifting of restrictions and how those interplay and interact with transmission of the virus. And I do think that there's potentially at times ways to leverage in some of the experience from councils, environmental health teams or whatever to assist with that process, and also potentially to assist with the enforcement, because we are seeing a situation out in the community where people appear to have less care and attention in terms of the basics around mask wearing and social distancing. And I think it's important that we have a cohesive message on that, and that these regulations are addressing those issues in the best way possible. So I think that's something to consider. I did want to ask you that, and I know some of the powers actually haven't been activated, but would it be possible for the department to provide us with a breakdown in table form of which of the powers have been activated and which haven't been activated, just to give us an idea of which of them have been useful? Is that something that you can provide to committee, Richard?
Yes, Chair, that's certainly something we can provide. And we're also looking at, we know that magistrate court orders have not been applied or used for during up to date on the pandemic, and we're looking at or taking legal getting advice on whether we can remove those powers for a magistrate court, as it's very difficult to retain a power that has never been used.
Yeah, and are you aware then, in relation to the other part of my question, are there any plans or work ongoing to improve how we monitor the impact of the restrictions, how we enforce them, and how we provide that evidence and build that learning into the process in a dynamic way going forward? Is there anything ongoing with that area?
I know the executive's COVID task force is the group that the various bodies that would look at enforcing and messaging there. It's an area of work that they're involved in, and I certainly not in the regulation or the order side have been involved with that work.
Okay, I'll go across to members then for some questions. I'll go an indication there from Jerry. Carol, go ahead, Jerry Liddahall.
Yeah, sorry, Chair. Can you hear me okay?
Yep, I hear you there, Jerry. Thank you.
Yeah, apologies, there's a reconnection issue there. So just my understanding of this, just a point of clarity really from my end, is this is really an extension of what is and what has been for an extra 6 months, really, beyond the March deadline. Second point is, has there been any consideration or discussion or idea about what happens if there is no health minister after the next, or no executive rather, after the next elections? And if that's the case, implementation of these regulations and powers, who does that fall to? Is it the Secretary of State? Is it the Permanent Secretary of the Department, or whomever? And then just finally, presumably, because this is an SL1, this will go to the floor for a vote. Maybe that one is for Keith, but just a couple of questions there. Thanks.
I'm not fully up to date on what the procedure would be should there not be an executive but I certainly can provide that information. And yes, your second point, it is intended that this would be brought, this order will be brought before the Assembly, and we would use the normal confirmatory procedure to bring the order before the Assembly.
And just sorry on that, obviously, because it's an SL1, there can be no amendments as to vote to extend or not, or abstain or whatever. There's no attempt to amend the initial legislation, or is there the possibility of that?
I'm certain. I mean, other than looking at, as I say, some of the provisions which have not been used would be difficult to retain, certainly around magistrates' court orders. But I don't think we can bring amendments to it.
Okay, thank you. In relation to the fact that we do have a fully devolved health system here, Richard, and can you describe for me how the department here has taken on board recommendations from the like of the World Health Organizations and international best practice? How do we go about accessing that information and then applying it in a way that directly impacts here and that deals with the situation that we have? And I'm asking that in the context of the fact that we have seen hospitals and rates of transmission to a degree where hospitals have come under pressure repeatedly throughout the pandemic, and I acknowledge that a lot of those pressures were there and COVID has made things worse. But how do we link directly into the best practice and the guidance coming from some of the major health organisations around the world?
Firstly, it's not that's outside the sort of my area of expertise, and it would certainly be from, we have the chief medical officer and the chief scientific advisor takes that information in and provides that advice and guidance through to the executive.
Okay, and we will. The minister will be appearing with the committee next week, so there will be an opportunity, I suppose, to follow up on that with the CMO or the minister. But the other element then in relation to that is the fact that we live on an island here, a small island, and recognised widely. Although I do want to follow up with the minister in relation to this, recognised widely as a single epidemiological unit. In terms of moving forward and in light of seeking an extension of these powers, can you outline how restrictions are being discussed or managed in relation to the 26 counties to ensure the greatest harmony or the greatest impact, and what plans there are to improve that going forward? Because I want to say I do think that there have clearly been issues there. I'm not convinced that those issues have yet been fully resolved, but they need to be urgently, given that we are still in a pandemic and that we're looking at extending emergency legislation. I think it's incumbent on both departments on this island to do the maximum they can. So can you outline how that process has worked up to date and what plans there are to improve it in the future?
Again, it's not one of the areas that I've been involved with, but I know there is work within the department and between the two jurisdictions to work together as best as they can.
Okay. A considerable number of the powers have been a considerable number of these powers provide power to the Department of Health or other executive departments to act unilaterally. Is that correct in relation to the response here?
I mean, that is correct, but I mean, sorry, the minister himself has said that he won't be acting unilaterally. He will always seek to get the agreement of the executive.
Okay. I don't think there's any other indications from members. I'll just check with the clerk before I... No. Okay, so listen, I want to thank you, Richard, for coming to the committee this afternoon and for briefing, but we can continue on then now to consider the regulations and we can let you go. So thank you for that, Richard.
Okay, thank you.
Okay, members, are members therefore content that the department make, or well, first of all, I'll ask if there's any other comments before we go on just to the formal piece. No, thank you. So are members therefore content that the department make the statutory rule? Yep. Members content, thank you. Okay, members, moving on then to correspondence, item 14. And if you look to tab 14 of the pack there's a number of items that I would like to draw your attention to. Item 14.12 is correspondence from a number of carers regarding the services remobilising pathway carers. I will ask members if they have any comments in relation to this, but I do want to say that I am extremely concerned that there appears to be a difference of view in terms of how this moves forward. We are very conscious that daycare centres and respite services have not been fully reinstituted. There continues to be a lack of capacity, a lack of return to full capacity, and that was probably even struggling pre-COVID, but it's leaving families in extremely difficult situations and struggling to cope, to be quite honest. Many families that I know of at breaking point and beyond at times. So I think it's a really important issue, this. I think it's one we have to get clarity on. I think it's one we have to see progress on, quite frankly. I don't understand why there's not a greater focus on in terms of the stress and distress that's being caused to these carers. So as a minimum, I would suggest that we forward to the Department of Health this correspondence and the PCC and ask them to comment on it, and then we can come back and look at this again more substantially based on their response. So I do see Carol's hand there. Go ahead, Carol, please.
Yeah, Chair, I completely agree. I mean, we all welcome the additional money going into domiciliary care, but as you point out, there's additional concerns here. I mean, even some of the issues that Chesney have raised as well, if their experience could be, sought. I mean, the issue for us is that we all want to try and protect people who are really vulnerable, but because there's so much disparity, it's actually causing inequality and distress, and the lack of respite care and daycare, and even just contact with loved ones in residential and care homes. It's just so diverse that particularly with people with dementia, that too many families are in the media saying that their loved one's condition has regressed through a lack of contact, and I mean that's something we're all very, very concerned about. So I do think we need further details, and how that happens, I don't know, but certainly it's something we need to have a better look at.
Okay, thank you, Carol. And Jerry, go ahead.
Yeah, thanks, Jared. Thanks for raising it. And I agree with Carl. I think we need more information. I mean, obviously, money in the workers' pockets is important, especially healthcare workers, and the fact that they're all being offered below inflation pay raises across the board is generally concerning. But a question I think we all need to find out from the Minister is whether this money will go directly to the workers' bank accounts, paychecks, whatever way you want to frame it, rather than through the organisations, through agencies, and then to the workers. And the fear, if it's the latter, is that money will not obviously go where it's intended. So if we can somehow get that information off the Minister and the Department, I think it would be the benefit of certainly mine and other people's constituents, I think. Thanks.
And just for clarity, Jerry, that's in relation to the issue that I raised in Chair's business around the allocation, and that we include that in that correspondence. We have asked for a number of further details to be communicated to committee, so we'll include that as part of that. Yeah. Okay, Pam, go ahead.
Thanks, Chair. Just say I don't disagree with anything you've said there. There are legitimate concerns there, so we need to forward those to the Minister for response. I think it's not good enough. The provision is not good enough, and this pandemic has had a very detrimental impact on certain sectors, and I think it's on us certainly to ensure that these issues are addressed as quickly as possible. It's been far too long that there's been little to no provision for the sector.
Thank you, Pam. And yeah, and I also want, and I think it's appropriate to commend all of those organisations and individuals who continue to advocate and lobby to try to get a breakthrough on this important issue. Many of them struggling themselves to deal with really difficult current situations, but also trying to advocate for themselves. And I think to get it across, I think there's a feeling that maybe there's just a lack of understanding of how grave the impact is and how difficult it is to continue in the current climate to manage the care situations that they're dealing with, without the support that has been withdrawn and not fully restored as a result of COVID. Okay, Carol, I see your hand there, but I'm not sure. I think it was up from previous, was it? Yeah. You're okay? Okay, thank you. Okay, members, so that's okay. Content with that approach. Item 14.13 then is from an individual regarding stem cell transplants for children. Do members have any comments they wish to make in relation to that? I think it would be appropriate to forward that correspondence to the Department, Public Health Agency and the Belfast Trust for comment. I think it's certainly, again, something that is indicated, but do members have any other comments they wish to make in relation to that issue or of correspondence? And are members content that we forward to Department, PHA and Belfast Trust for comment? Yeah, thank you. Are members any comments they wish to make in relation to any other items of correspondence today? No, and therefore can I ask members if they are otherwise content with the actions on the main correspondence list? I am going to table papers also. Yep, members content, thank you. So members, in terms of table correspondence, at tab 14.15 of the table pack, there's a response from the Minister advising that he has written to the Speaker to advise of his intention to bring forward an amendment to the Adoption and Children Bill, which will introduce a statutory duty to compel institutions to preserve and not destroy records relating to mother and baby institutions, Magdalen laundries and other related institutions. And that correspondence is in response to committee were asked last week. It was highlighted that a member of the Assembly, Linda Dillon, was planning to or looking at taking an amendment and had sought our assistance to see if the department were considering or would consider taking such an amendment. And I think it's very welcome. I think it's a very important issue from what we have heard here in committee of the importance of people being able to access their own story, their own records, and to do that in a way which doesn't cause additional distress. So I think that is to be welcomed, and I want to acknowledge the department doing that. Any other comments in relation to that item?
Chair?
Yes, Paula?
Thank you, Chair, and I welcome the Minister's speedy response to our query in this regard. I'm sure it will give a lot of comfort to those campaigners who are looking for the information and have been doing so for many decades. So I just want to support the Minister in that, and I think that it was great that Linda Dillon was taking that forward. But I think that as a committee we probably would have reached the same position ourselves. So we're all on the same page for once, which is great.
Thank you. Yeah, thank you, members. Okay, so content with that. Moving on to tab 14.16 is a response from the GMC, providing a copy of its response on the duty of candour, consultation and other issues. Do members have any comments to make in relation to that item? No, thank you. Okay, members, moving on then to the Forward Work Programme, which is at tab 15.1 of the tabled pack. And I suppose I just do want to flag to members that in relation to the recent SR, there is an indication that we may be receiving that SR within the next very short period of time. So I think it will be maybe necessary for the clerk to look at and the committee team to look at the Forward Work Programme as to how that can be accommodated. Do you have any comments to make, clerk? Or?
No, just to say it's the SR in relation to the COVID certification. So we know it'll be coming probably next week, so we'll just maybe need to move things around a wee bit next week to make sure we can get that briefing. Okay,
so thank you then, and considering taking that into account then, are members content to note the Forward Work Programme at tab 15.1?
Chair?
Yes, Pam, go ahead.
Yeah, it's just to say, happy with that. I understand there will need to be changes, but I'm just kind of wary that I know Paula had mentioned last week wanting a brief from the Trust and the winter pressures, and I completely agree with that as well. I'm just kind of conscious that the work pressure is very great on this committee, but I'm just conscious that there's other issues that we do need to have briefings on, and I think we should find a way to make them happen. And I'm thinking in terms of a briefing from the department on transformation, where we're at with that. It's just too critical to let slide. And also, I would like to have a briefing on Encompass to see where the department is with that and what progress has been made, because I think it's really vital in terms of transformation that we know where we are with this programme, because this has been seen certainly for a long time as it's going to be something that's going to make a real impact on changing how we gather and use information and plan going forward. And I think there are consequences not just for the health service but our GPs and also pharmacy. So I think it's really important that we do try to get to these briefings as well. I think we can't afford not to have those happen at some stage in our forward work plan.
Yeah, and I suppose we will need to, in the early new year, take another look at our overall forward work programme. I suppose a lot of the pressure around legislation is building up in this and the January period, just in terms of deadlines for the assembly processes. But yeah, I think we will. So those are noted anyway, and we will take a look at those and all, as you say, important issues. Carol, you were looking in there?
Yeah, I mean, I agree with Pam on the issues that she's raised, and I would also like to get an update. I know the Minister had said previously that he was talking about the Health Summit when the budget was confirmed, but particularly in relation to transformation and recovery from COVID, I just find it a bit bizarre, to be honest, or maybe odd, whatever, that Health Summit hasn't happened. I mean, these are directors and clinical leads in their fields, and everyone has said they're going to be adaptable and flexible as possible to try and address things like the waiting list and all the rest. But we still don't know what that looks like. So if we could try and get a written or oral presentation, whatever it is, as soon as possible, because it's just too important. You know, we are facing a lot in the new year, but we also need to know what the Minister's plans are for everything else.
Okay, thank you, members. And those are all noted. And I'm conscious now of time here in the Senate chamber, but any other business today, members? No. Okay, members. So date, time and place of next meeting then. Our next meeting will be on Tuesday, 30th of November 2021 in room 30 at 12:45, where we will have a briefing from the Royal College of Surgeons on winter pressures. Thank you, members, and please take care until we see each other again. Thank you.
Programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber.